And you're live. You're good to go.
Oh, I have a script that I need to read, so I'm going to go ahead and go through that this morning. Hello, I am Patsy Zeller, and I serve as the president of the Kansas State Board of Nursing. I ask members of the board to respond to a roll call to signify their presence at this open meeting by a conference call. Zoom. Rebecca Sanders,
Present.
Juliana Resnick,
Present.
Carol Bragdon.
Present.
I guess Gwendolyn Lloyd is not on here. She's on our list, but not present today. Audrey Goldsmith,
Present.
Mandy Carstetter,
Present.
Andrea Watson,
Present.
Giovanni Gone, Giovanni, are you on the call? On the Zoom today? I don't see her on there. So Gita Noble,
Present.
Jade Ramsdale.
Present.
I also ask the following staff members who are also present to respond. Carol Moreland, Executive Administrator.
Present.
Adrian Guerrero, Director of Operations.
Present.
That says share screen. We don't want to share screen, right?
Linda Davies, Practice Specialist.
Present.
Janelle Martin, Nursing Education Compliance Officer.
Present.
Jill Simmons, Executive Assistant.
Present.
Public comment allows individuals to address the board about their concerns, but the Kansas Open Meeting Act, which is known as KOMA, does not require the board to provide public comment or answer questions from individuals. Today, we will have public comment, but speakers are limited to 5 minutes due to the length of the meeting and the possibility that the connection for the remote meeting may be lost. Because you are conducting this public meeting by Zoom and YouTube, I state for the record the following information. On November 23rd, 2020, the board sent notice to the meeting for the board to all individuals who have requested notice at the board's meeting. Additionally, the notice and the agenda were posted on the board's website, ksbn.kansas.gov. The notice contains the link, information, and password to connect to the Zoom meeting and the link to connect to YouTube so that the public may attend this meeting free of charge. The notice also advises individuals to contact the board's office at 785-296-2967 if they experience a technical difficulty during the meeting. You may obtain a copy of the notice and the agenda at the website or by sending an email to carolmoreland@ks.gov with the subject line request for the agenda, and the board staff will send it to you. The state of disaster emergency due to the COVID-19 pandemic, as declared by Governor Kelly and extended by the State Finance Council, will expire on December 15th, 2020. Because the requirements of KOMA are not suspended, we will be conducting this meeting pursuant of KOMA and CAR 16-20-1 concerning compliance with the KOMA during an emergency declaration. The only mediums for interactive communication offered for this meeting are the connections by Zoom and YouTube. Each member of the board, board staff, or presenter shall state the person's name and title each time the person speaks or votes, as the case may be. Each participant to this meeting shall ensure microphones, phones, or other electronic devices are on mute when the participant is not speaking. Each motion will be clearly stated before the board votes, and the president will announce the results of the final vote. A statement or motion will clearly identify the authorized by delegation each member of the board or staff who will be permitted to sign a document on behalf of the board. The meeting is being recorded, and the recording will be posted to the board's website. The board has the following items listed on its agenda: call to order, review of on-site packet, additions or revisions to the board's agenda, announcements, approval of minutes of the committee's meeting in September 2020, consent agenda, item agenda, agency reports, committee reports, unfinished business, new business, executive session if needed, open forum if a presenter is scheduled, agenda for March 2021 meeting, and adjournment. As noted above, the board may take an executive session. If the board elects to exercise the option to go to executive session, the board will follow this process. First, the board must be in open session before going to an executive session. Second, then a motion will be made and recorded pursuant of KSA 75-4319 small b. The motion must contain the statement of justification for closure, the subject to be discussed, and the time and place the open meeting will resume. If a motion for executive session passes, the members of the board will return to the Zoom and YouTube meeting after the executive session. The public will be excluded from this portion of the meeting as the executive session will be conducted by electronic means that will not be made available to the public. The open meeting will resume when the board members return to Zoom and YouTube. The complete motion for the executive session will be recorded in the minutes. And this meeting is now called to order, and the board will begin the meeting with the next item on the agenda.
I just want to point out, I think we gained Giovanni.
Okay. Giovanni, you're present, correct?
Yes, I am.
Okay, thank you. We'll put that on the roster that you were here for this meeting. So we have called the meeting to order. Review of on-site packet. Carol, there was some in the on-site packet.
There's nothing for the board for the on-site packet.
Okay, additions or revisions to the board agenda. Does anyone have some to add? I have a couple things here. Under new business, after number 3, we're going to add a number 4, which is going to be executive session number 1. And then we will go to the board member training. And then the number 6 will be executive session number 2 that we will. And then we have somebody that would like to speak in the open forum that will be at the conclusion of this agenda, not necessarily 1 o'clock, but will be at the conclusion of the agenda. Following. Anything else, Carol, that we proposed for the agenda?
No, that's it. Thank you.
So Jill has all the motions, and so she's going to help keep me online here and make sure I don't pass one of them. Would you read the motion so we can do that?
Sure. Is there a board member who would like to make the following motion? I move to approve the agenda as amended.
Madam Chair,
This is, go ahead.
I so move. This is Rebecca Sander, board member.
This is Mandy. I will second.
Motion is second. Any discussion? Hearing none. All in favor say yes.
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 All
Yes.
opposed say no. That motion carries. So the agenda will be as amended. Next thing is announcements. Do we have some announcements? Carol, do you have any?
No, I was just going to announce a couple things when I do my exec report.
Okay, that would be great. We'll just keep moving down the agenda then to the approval of minutes. Did everyone have a chance to read the minutes from September 16th? Any additions, revisions, clarifications, any changes we need to make there? Not hearing any. Do we have a motion, Jill?
Yes. Is there a board member who would like to make the following motion? I move to approve the minutes from the September 16, 2020 board meeting as written.
This is Andrea Watson. I'll make that motion.
This is Geeta Noble. I'll second.
We have a motion and a second. Any discussion? All in favor say yes.
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 All opposed say no. Any abstentions? That motion carries. We're going to move to the next piece that's into agency reports, the executive administrator report.
Thank you, Madam President. This is Carol Moreland, and you can find my report under reports on your iPad. Should have downloaded to your iPad. If you want to follow through, or you can just listen, whatever. There's some upcoming meetings, and I just listed a couple of them. National Council's mid-year in March. That's going to be held virtually. Usually it's the president and myself who attends, and if anyone else wants to, you might just kind of talk about that, because we'll probably have to register. Well, we definitely will be registering soon, probably. I don't know if they're going to be able to have more since it's virtually, but if you can just kind of direct me about who might be attending, so that when that comes out, I can make sure that they get registered.
Do we
Madam
have,
President,
go ahead, I mean to interrupt.
sorry, I was just gonna say, I have gone a couple times and I really enjoy that meeting. If there's space, I would like to go. This is Juliana, sorry.
Carol, do we have funds for other people to go, or is it usually president, executive officer, and one other member?
Well, it's usually, I believe, 2, and then we can request resource funds, but with it being virtually, I'm not sure exactly how that works, because, what the funds paid for, yeah, Adrian might know.
Yes, it's unlimited. Anybody can attend since it's virtual this time.
So I too, like Juliana, I've been several times. It helps put the picture together as to how all this networks and fits. It's pretty amazing. National Council does a great job with that. Virtually, it's a little tougher, but if you're interested in understanding how this all works and puts the wheels in motion, this is a good place to start. Carol, how do you want to do this? Do you want anybody to contact you if they're interested in being registered?
Sure. I just want to know so that when I get the communication from National Council that we can go ahead and register, that I know who wants to be registered. That's the biggest thing there. So I have Juliana, Patsy, myself.
And what's the
Anybody
date?
else?
What's the date again for that?
I have March 9th through 11th, unless something's changed on that. I don't know. Adrian, do you know?
I think you're right. I believe it's in that time frame. I think it's going to be less one day, but I don't have it exactly on my calendar. I apologize.
That's okay. We can find out and let the ones who are interested know. How's that sound? But if there's anybody else, just please send me an email soon, because I would imagine we will start hearing fairly soon to get people registered for it.
Carol, this is
Okay.
Jade Ramsdell. I'm interested as well.
Okay, great.
Thank you.
Thanks, Jay. Anybody else? Okay, well, if you change your mind and want to be registered, just send me an email and we can certainly do that. Okay, and then the annual meeting in August, 18th through the 20th, and hopefully we will be traveling and it will be in Chicago. And usually it's the board president and the executive administrator that are the voting delegates from Kansas. So we can talk about that maybe in March, if we know a little bit more then. The thing I put in there next is kind of the agency's response to the pandemic. Again, I just want to start out saying how wonderful and awesome our agency staff has done throughout this whole thing. If you had told me that 70% of the employees would be out teleworking before this whole thing happened, I might have gotten a little uncomfortable, but I think it's going very well. They are doing what they're supposed to be doing. And I think the functions of the agency are going well. We've dealt everywhere from not being able to get anyone into the agency to what we're dealing with right now is we don't get central mail delivered to our agency. So staff stepped up forward and said, we will go out and we will pick it up and stuff like that. So they're just, they're really great about stepping up to the plate, and the flexibility has just been really awesome. So we do still have 70% of our employees teleworking, and we will continue. So we have a small number in the agency to support the ones that are teleworking, and it seems to be working well. We've had some exposure concerns within the agency, so we've had to kind of work with that a little bit. But truly, I think it's going well. I really do. The state of emergency declaration now, on November 13th, it was extended to expire to December 15th. The State Finance Council is the one who determines this. I would imagine they will be meeting soon, because I would anticipate that's probably going to be extended for another 30 days, which would be January 15th. The impact that has on us as an agency is Executive Order 2064 basically said that all professional licenses, their expiration dates would be extended through the state of the emergency declaration. So for the new board members, what that basically means is we keep extending the ones that would have expired anytime from March of 2020 through November 30th. They actually have until December 15th to renew. And so if it gets extended to January 15th, then that will pick up the December 31st ones that expire. They would actually have until January 15th. It's very difficult for us to know exactly how many nurses are taking advantage of this. When they call me, I explain that that is an option they have, but they also have to be aware of what that moving target date is, because it does move. We put the information on our website, we push it out through communication, but we do not call every nurse and say, your date has now changed to such and such. And I also tell them that the thing to consider is if they take advantage of this, that's fine, they certainly can do that, but their next renewal period is going to be short, because it does not change the renewal cycle for them, because that is basically in our Nurse Practice Act. And they're like, oh, okay, well, I didn't know about that. So that basically means they have less time for their next period to get their 30 hours of CNE. That seems to be the biggest focus for them. And it's true. So some of them are just like, I have my CNE, I'm just going to go ahead and renew. And that's fine. They can certainly do that. So it's very kind of difficult for us to tell exactly how many are taking advantage of this. But they certainly could have like a 9-month extension almost on when their license expires. So we kind of try to keep up with that and get our licensing software changed to reflect the correct date and things like that. I included in my report some stuff on House Bill 2016. House Bill 2016, I think, is very important to the employers right now, because it does have some provisions in there that helps with dealing with the pandemic and the not enough staff and everything like that. I put this in here because this bill was passed in June 2020 in the special session. And there is a section in there, it's section 23, that basically deals with us. It's a very big bill, but section 23 is what deals with us. The bill is in the staff report section if you choose to want to read it. But if you want to fast forward through to section 23, that's basically what deals with us. It's the governmental's response to the COVID-19 pandemic in Kansas. Here's just kind of a brief overview. The APRNs employed to support a facility's response to COVID may work as necessary without direction and supervision from a responsible physician. Same thing with the RNAs, the nurse anesthetists. But again, this provision expires January 26th, 2021. RNs or LPNs may order the collection of throat or nasopharyngeal swab specimens from individuals suspected of being infected by COVID-19 for the purposes of testing. That also expires January 26th of 2021. LPNs may provide healthcare services appropriate to their education, training, and experience when employed or contracted to work to support the facility's response to the pandemic without direction from an RN. That also expires January 26th of 2021. RNs or LPNs who hold a license that is exempt or inactive or whose license has expired within the last 5 years may provide healthcare services appropriate to their education, training, and experience. That also expires January 26, 2021. Another provision allows a registered nurse who's serving in the military to volunteer or work within a facility in roles that are appropriate to their education, training, or experience. That expires January 26, 2021. The next one I think is probably a big one that is being utilized by some employers. A nurse licensed and in good standing in another state may practice as a nurse in the state of Kansas. They don't have to do anything with us. It expires January 26th of 2021. Another provision, nurses meeting the requirements of this act may have their license reinstated within 5 years of the lapse without the requirements of continuing education or payment of a fee. And how this works is nurses wanting this provision will be given a temporary license that expires on January 26, 2021, because that's when this provision expires. After that date, the nurse may apply for reinstatement of the license and meet the requirements of reinstatement. And then another provision that we've had some questions about is allow a student who's enrolled in a program to become a licensed, registered, or certified healthcare professional, so this would be your nursing students, to volunteer for work within such facility in roles that are appropriate to each student's education, training, and experience. Again, that expires January 26th of 2021. I wanted to kind of go through this with you because I think it's important that these all expire January 26th of 2021. I do not know if there's any plans from the legislature. They come back in session January 11th to address any of this in a 2-week period, basically, almost, to extend these provisions. I would hope that they consider that because, again, I think you get a lot of questions about this from employers and stuff like that. You know, another thing I wanted to share with the board to kind of get your feedback, we're starting to get a lot of questions about what the Board of Nursing is doing about the staffing shortage out there. You know, how I basically handled this is to help them to understand the mission of the board, because some nurses truly feel that the board is here to be an advocate for the nursing. And I've had employers tell me that they feel like that the Board of Nursing is here to ensure that they have enough nurses. So I've tried to help them understand the mission of the board. And also I've explained to them that we have no authority in the Nurse Practice Act for employment. Basically, our authority is for licensure, education, investigations of possible violations of the Nurse Practice Act, and then discipline of licensees who have violated the Nurse Practice Act. I do refer them back to, you know, the Executive Order 2064 that extends the expiration date, you know, and then refer them to the provisions of House Bill 2016 that I just kind of talked about. Some other things, just to kind of let the board know, we are working with KDHE. They are putting together an RFP to try to get some staffing agencies or something like that to be able to provide healthcare workers. I think what people don't understand is it's not just nurses that there's a shortage of right now. So for, you know, the nursing board to do something and the Board of Pharmacy to do something and the Board of Healing Arts to do something probably is not the best use of everyone's time. However, KDHE is looking at the whole picture in their emergency management. So they see all the healthcare staffing issues, not just nursing. We have told KDAG that we're very willing to share any information with licensees that's given to us from them that they would like to be shared. We do not know how many of the licensees employed and how many are licensed, but they don't work. That's again, we don't know that information. And then the other questions that we're starting to get a little bit more about is how KSBN is planning the vaccine distribution. So again, I kind of explained that as there's more disciplines than nursing involved in this. So again, the emergency management out of KDHE is the one that's overseeing the vaccine distribution plan and how that's going to work. They have contacted us about other things. And again, we're working with them for anything that they need. I know the director at KSNA is actually on the task force that's working on that. And I just talked to her Friday, and she wanted to share with me that part of the discussion that they've had is that students could be very helpful in the distribution of these vaccines. And could it count for clinical? And so I did explain to her that a lot of the nursing programs in the past have used flu vaccination clinics and stuff like that as clinical for their students. So I just wondered if the board would like us to send out an email to the program administrators with maybe the contact information, if they want to know more information or who they need to talk to about getting their students involved. I've had, healthcare clinics contact me throughout the state, and what I've suggested to them is that they contact the nursing program that they might be close to, contact the program administrator, and start some discussion about would it be possible for your students to help with the vaccination? Because I did share with them that the nursing programs are having a hard time getting clinical sites right now. And so perhaps they would welcome this opportunity. I don't know. That's kind of up to the nursing program. But I just wanted to share these questions about staffing shortages and stuff, because I don't know if there's a way that you want us to answer it differently. Anything that you could tell me would be helpful?
So
Go ahead.
I was just going to share that through our work within Ascension Via Christi, we are preparing to deploy vaccines as early as next week. We have been in touch with many nursing programs, and we are going to be using students. I don't know that the schools have the information. We are reaching out to the schools and pulling them in. So I think the communication to students and those that want to participate in vaccine dissemination, at least in the Wichita market, should be in touch with the hospitals. And we have lots of openings for anyone who would be interested in paid positions, temporary positions, all kinds of support type nursing roles. You're absolutely right, Carol. It is more than just nurses. So we have opportunities for things that we call like a functional nurse, somebody who maybe hasn't practiced for 4 years or is in a setting that they're not entirely comfortable. We have a shortened education program that we're putting them through. So I don't, at least from the folks that we've been in touch with, I don't know that it's the schools that can help as much as if they would contact the hospitals directly.
Okay. All right. That's helpful to know. Okay.
Any other input for Carol from the group? A lot of us are pretty close, especially in small areas or rural areas such as myself. We're pretty connected to the clinical sites, so we're knowing about the need, but some places may not know that. I don't know. Any other comments for Carol that she can pass along? Okay, thanks, Carol. Anything else for your report?
Sure. Yeah, I just wanted to kind of let you know about the budget. Fiscal year 21, 22, and 23 budgets are the ones that I submitted. They've made it through the division of budget with no changes. We've talked to legislative research because they're the ones who kind of prepare for the governor. You know, when the governor does her budget recommendation in January, we've answered their questions. Really, there's the only thing that's probably out of the ordinary that we're asking for is in fiscal year 22. We're asking for an increase of about $225,000, 25,000 of it being for the enforcement software to go with our licensure software. Enforcement software is something that we have needed for quite some time. It is going to be documentation and tracking then for the investigators and discipline. Right now, how they have to track like the investigations and the discipline is really, for the most part, not done in our licensure software. So it's very fragmented, so to speak, as far as tracking and following information. So if we can get that enforcement, that is going to be a huge, huge step forward, I think, for especially the investigative division. And then we put $200,000 in there to update our data center hardware and any software licenses and stuff like that. You know, we've, because of the pandemic, we've done even more and more electronic, but we have to be able to keep our IT infrastructure current and everything like that. We don't want to be like other state agencies who perhaps could not support what they have to do because of IT infrastructure that hasn't been updated or something along that line. That would be huge to the nurses, to the employers, if we were not able to do our functions that we're supposed to do. And so we did put that in there. Then in January, the governor announces her budget for the agencies. And then in February and March, both the Senate and the House have appropriation committees that will look at it, and we'll go over and testify in front of them as to why we need it and stuff like that. Regulation revision, I just wanted to talk about this just a little bit because the undergrad nursing program regulations are still going through the process. It's been a long process. COVID slowed it down tremendously, but I think it's kind of everybody's getting their process kind of working a different way now because of COVID. And right now, everything has been through the division of budget. And there's like one provision that Department of Administration and I are working on the wording and stuff. It's one that was changed. And so we're just working to clarify that a little bit. And then as soon as all of that gets through Department of Administration, then it will go to the Attorney General's office. They will review all of them. These have been through the Attorney General's office, I think twice before. We've made any requested changes that they've wanted. So I'm hoping maybe there won't be much of a problem this time with that. If it gets approved by those three agencies, the next step is that a 60-day public comment has to be published in the Kansas Register. So what that 60-day comment means is anyone who has comments about them, because they would be available on our website so everyone can see them and all of that. There's nothing, that's not transparent about these. During that 60-day period, anyone can submit comments that they want to us. There's a public hearing that is scheduled at the end of the 60-day period. And anyone can join that public hearing and state their comments there. It's usually done by conference call. If they do verbal comments there, they have to be followed up with a written, because all of these written comments then come back to the board. So the board is aware of all the comments that we have received. Another thing that takes place during that 60-day period is I go over and I testify to the legislative committee that looks at changes to administrative rules and regs. And they again provide comments. Those comments go back to the board. Once the board at the board meeting looks at those comments, they have the option to make changes at that point. And those regulations will start back through the process again. Or they could, table for more discussion if they wanted to, or they can adopt them after they have reviewed those comments. But I want to make sure everybody's aware of this because I know I have received information that there's some controversial things in there and some people are concerned, and that's fine. And I tell people that they are going to have the opportunity to provide comments, and all of those comments do go back to the board so that the board can review all of those comments. So that's kind of where those are at. I just put in there, legislative session starts January 11th, 2021. There have been some discussions about what kind of COVID precautions are going to take place. Of course, requiring masks. They're talking about closing off balconies in the chambers to allow seats for the social distancing of the legislators because they do sit fairly close down on the floor. Policies about who's going to be able to get into their offices to ensure safety of their office assistants. So they have this big virtual State House project working on that. The goal is to make the legislative meetings available virtually to the public. So where, like if I testify, it may be done virtually instead of going in person. Because I will tell you, the rooms in which the committees meet usually are very small, and there's usually a lot of people in there, and that's not what needs to take place right now. So you'll probably see some changes with that, would be my guess, once they start the session. I just put down there the meetings that I've attended. One thing about meetings being virtual, it's a lot easier to attend them because you're not traveling and stuff like that. Not to say that I miss the travel and stuff like that, but anyway. Board member information is down there. Agency vacancies. I am very happy to report that we have the CNE education specialist position filled. It is filled with Chelsea Stevenson. Chelsea has been with us for almost 2 years as our education secretary. But what Chelsea has been doing that whole time is working on getting her degree in education. And she kind of got held up just a little bit finishing her bachelor's because of COVID and not being able to do her internship. However, she, in the meantime, has started her master's level courses in education. So Chelsea will be moving into that CNE education specialist position next Monday. I'm very excited. She will do a wonderful job with it. And we will fill the education secretary position. I know there's probably concerns about that because that position is very, very important, and we will be advertising and filling that. So other than that, we have an RN investigator position. We have a senior administrative assistant for licensing and education specialist, and we have a scanning document position. Let me see. I think probably all the rest of it is you can just kind of review that. If anybody has any questions for me.
Thanks for the report, Carol. Any questions from the group about any of that?
This is Gita Noble, and I do have a question. Carol, can you help me understand the board member orientation you have planned for new board members before September?
Yeah, we actually did that. But I guess maybe I would like a little bit of feedback because I'm not sure. I'm not sure if the communication that we're sending out is maybe not as helpful as it needs to be or something. We did that orientation on Zoom for new board members. We do it for new committee members also. But I'm just thinking maybe there's something else we need to do. So that feedback would be very helpful. I know there's been a little problem with getting people connected, or they're not really sure how to connect and stuff like that. So if any of you have feedback about what you think would be more helpful to you as a board member or a new board member to try to understand this whole process, that would be extremely helpful. Because usually we do the board member orientation once and that's it. But maybe we need to do something different. I don't know. If there's any feedback that anybody has about what we can do to make this easier for board members, we'd really appreciate it. And if you don't know today, you can always email me or something along that line too. Yeah, I know there's a lot to think about today.
Well, the only reason I'm asking is because I am fairly new to the board and I apparently must have missed that orientation and I'm not sure about how that communication is happening. So yeah, I don't have a solution right now, but if that's something we could probably talk about at some point in time, I would appreciate it.
So you did not attend a board member orientation?
Remind me when it was, please.
I don't know off the top of my head, but we can certainly do one if you did not. I guess I somehow thought that we had covered everybody, but perhaps I was wrong. We can certainly do that again.
I would
And maybe it would be
I would
helpful if
appreciate
we,
one, please. Yes.
okay. And maybe we can offer it to any of the new board members because maybe now that you've kind of dabbled in
I was going to
this,
say.
maybe it would be helpful to go back and do it again and it might make a little bit more sense. I don't know.
That's what I was going to say.
Okay, we can certainly do that. Yeah, definitely. Not a problem. Okay, we will work on that. Let me make myself a note.
Carol, this is Giovanni Gone. I'm one of the new board members. We did have that new orientation on September 2nd. Adrienne went ahead and did that, and we did meet a couple of us. I think that's something that has really helped me is having a mentor and just being able to talk with them. So I do appreciate that that was set up for us. So I found that very helpful.
Okay, thank you. I appreciate hearing that. Yeah. Well, we can certainly set up another board member orientation. And, if we need to do more than one and get the times out and whoever feels that they want to participate in that to kind of, because you probably have more questions now than you certainly did then. And that's understandable. And so we can, get those questions answered. So thank you for bringing that up. Appreciate that.
I've attended that orientation several times and I've been around this process a while, but every time I attend that, I learn something new. It's like I didn't really know that, or I guess I heard that but forgot. So we could probably send that out to anybody that's on the board. And if they'd like to attend, they can, just to buff up a few areas if you want to. I think it's very helpful. But anything else, Carol, for your report?
No, I don't have anything else unless somebody has something for me. Thank you.
Questions? Okay, thanks for that report, Carol. I guess we'll move to the staff reports. I just made a list here and not any certain order, so I'll let Linda Davies go first. She's like, wow, me? Okay.
I know, I'm usually like last, so Merry Christmas to myself. Thank you, Madam Chair. This is Linda Davies, the practice specialist. First, I will note that my report that's been uploaded for you has some highlighted areas, and these are the correct numbers. I'm not quite sure where you get a little extra color in this report, but Merry Christmas. Investigative new cases that were opened for this quarter was 127 total, and we broke those down into impairment and abuse. So we're running around 10% for the ones for impairment. Those are the ones who I think we're really trying to focus on and get them into some rehabilitation if that's possible. The case studies you'll see for the following years, 2017 through 2020. And I will mention that the decrease in numbers for the cases that dropped for 2020 are due to a couple of factors. One, we are not opening cases related to applications with legal history due to changes that were made last December and in July. And these included, we don't receive the driver's license folder anymore. It's not required for the applicant to present with their application However, if the investigator wants this, they can and will ask for it. And then as of last December, the investigative committee decided that we would look at misdemeanor convictions within the most recent 10 years. So that and the second reason that our reduction is because of the response to the pandemic, and we're learning to work remote. And as Carol had indicated, our processes were all paper, and so we're learning to have electronic means, but we don't really have an efficient system because we don't have the enforcement piece that would help with our software system for documentation. So those two reasons are pretty much why we're seeing a decrease in our number of cases that we've opened for 2020. You'll see our reinstatement, our administrative fines for unlicensed practice. We've only had 5 where we've fined those, and those fees I do not believe go to our fee fund. They are paid to the general fund for the state. If I'm correct, I believe I am. But you'll see that there's not been a lot of unlicensed practice, and this is because of the executive order that extended the license renewal expiration date. So we are not seeing that currently, but we are watching for those who want to reinstate and have a lapsed license from before March 12th. Those reinstatements then are usually they're requesting a reinstatement, but they are factored from a board order before that they need to satisfy something before they can be processed. We do receive complaints from a variety of sources, and we are still tracking those. So we have had a total of 486 from July to September of complaints for nurses who are violating the Nurse Practice Act that have been received. So as far as supervisory issues, I had reported the last time about the applications for licensure review of legal history. And, in 2019, the data reflected 55 days to process. And the last September meeting, I reported that we were down to about 10 days. And that's running around the same 10 to 14 days is what I'm thinking this is going to fall out in. And that's really kind of essential for us to be able to meet the need for the Kansas workforce for licensed nurses to be on the floor and ready to work for hospitals who are needing those. We consider it necessary to process them timely as far as their application. A reminder, though, is that our mission is to protect the public. So when we request more information from the applicant, our primary concern is to make sure we get that information so that we can ensure that mission. Other applications that we also review timely, endorsement applications. These will allow for a nurse from another state who does not have a multi-state license to be able to work in Kansas. So we are processing those timely because then that would also increase the nursing workforce in the state of Kansas. Conversion applications where a nurse already has a single state Kansas license and wants to obtain the multi-state license so they can work elsewhere in the compact. This would have a negative effect perhaps on the Kansas workforce if those are processed to where they would possibly move out of state, but still those are processed pretty frequently and efficiently as well. Reinstatement applications, as I indicated, usually have a board order attached with it, and we need to have time to be able to review for sufficient and valid documentation before we can approve that license. Case investigation. One of the things that the team noticed was in the response time from the licensee or applicant. And whenever we're trying to get in touch with the licensee or applicant, we're relying on them to notify us timely or give us the information that we're requesting timely. So sometimes the case does not move along as fast as it should, or the application is not processed as efficiently as it should because we're waiting on them. So one of the ways that we looked at our internal process, and it was mostly virtual because about 70% of us are teleworking, but we looked at the means utilized to communicate with both the licensees and the applicants as so that we can get that response from them. And what we also looked at was the Nurse Practice Act, and it does not specify that a certain method for communication is limited to a phone call, letter, or electronic communication. So we did verify that we have options. So we did a study within our own little team, and what it revealed is that phones from the state of Kansas will pop up as a 000 or spam. And so the licensee or applicant is probably not likely to answer the call. And then if we were to leave a voicemail, the voicemail box is full or not set up. Addresses on file in the board office are sometimes also not updated, even though it's statutorily required to be updated within 30 days of the change of address. Therefore, letters that we've been sending out are sometimes returned undeliverable. Email addresses are also in our system, and those have been found to be often current, and the response being immediate from the applicant licensee when we communicate that way. So we drafted a procedure, and we would send a letter via mail, and then we would follow up with an email that said, did you get the letter? We're trying to contact you. Oftentimes the applicant or licensee would let us know that they received the email, but not the letter, or they would even say they received the email and call that same day back to the investigator wanting to reach them. So we've drafted a procedure, and we're monitoring this going forward, but we're looking at ways that we can communicate better to the licensee and applicant to be able to process cases and applications even more efficiently. CNE audits, they're being done in 2020, and it's by random selection. So I'll just give you an example. For the month of August, we did 90, were randomly selected for audit, and it's across the board. There were 16 APRNs, 51 RNs, 16 LPNs, and 8 registered nurse anesthetists. Not all of the 90 have responded, but of those who have, most are completing their CNE prior to renewal. So that's what we wanted to verify. Practice calls, besides the ones that Carol had indicated, we still get a variety of calls relating to hydration therapy, spa type clinics, and employers requesting a nurse to work in an area where the nurse does not feel they are well trained. And so we're trying to work through those things with those nurses. It is also noted that the pandemic response has led to a perception of increased stress for the licensees. And so the investigative staff is aware of this and how it might affect the behavioral health, mental health status of the licensee as it relates to any type of allegation of Nurse Practice Act violation that we might receive. So we want to make sure that they are supported, as well as understand maybe perhaps why they worked impaired or worked incompetent, so that we can get them rehabilitated as fast as possible. One thing that's not on your list, but I did note in my notes to report to you, is I do the open records requests, and for 2020 we've processed and completed 101 of those, and those are mostly the requests for investigative and disciplinary records. And as you know, data storage is an issue. So everything's paper, it's got to be scanned. And I'm working with IT and Director of Operations and Carol to justify our need for space on that IT network. So we did attend a variety of meetings. The one I will point out was that the NCSBN Board of Nursing Investigator Training, I did send our 2 new investigators, Nikki Snodgrass, our nurse investigator, and Evan Faulkner, our special investigator, to that. And it's a good baseline beginning for them to understand kind of how we need to investigate cases. So that's my report, and I will stand for questions.
Anybody have any questions for Linda? Okay, hearing none. Thanks for that report, Linda. That was pretty thorough. Appreciate that. The next person I have on my list is Janelle Martin.
Thank you, Madam President. This is Janelle Martin, Nursing Education Compliance Officer. And your education report should be in your packet. I'm just going to highlight a few things from that report. We have had 7 director changes this quarter. I just wanted to point out they're all listed there, but that's fairly significant when we have new directors coming into programs. A couple of them are assistant directors, but it's helpful to note that we did do a new administrator orientation in September, and so many of these have started since then. And I want to make a note too that we did record the session this time because we did it virtually for the first time. So we were able to provide that recording to administrators if they want it. And we also have provided the information slides on our website for program administrators under their resources. So I feel like that was actually a helpful thing that happened due to COVID because we had to do it virtually. We were able to record that for them and they're able to view that now, even if we don't do it again for another year. I wanted to report on our site visits. As you know, all of our spring visits that were done after March, we had 4 of them were canceled due to COVID. And I wanted to let you know that all of those were rescheduled and completed this fall. Due to the changes or to the updates in our site visit guidelines, we were able to do 2 of those on site and we did 2 of those virtually. And I'm happy to report that the ones that we did virtually actually went very well. We had really good communication with the program administrators and they were very responsive to the process. And I think we were able to complete and do what we needed to do. They were also very creative in providing some video for us on site and taking iPads places so that we could view things even though we were sitting in our offices. So I think it has provided a new avenue for creativity and it's good for us that can be accomplished. So I wanted to let you know that. I think our faculty qualification report process, it's the one we put online for our all new faculty members have to have a faculty qualification report submitted by their program administrator. And we did go to an online submission in June. And this is the first quarter that we've had all of them completed electronically. I'm still getting good feedback about that. I haven't had anything that we've needed to change this quarter, so I feel good about that. The process, it seems like, is going fairly smoothly. I do have a few more incompletes than I did before, but I think that's just part of the process, and we're seeing less and less of those as we go along. One of our biggest issues were we do have a process for higher exceptions to be done for faculty, and those have to be submitted with an updated or at least an initial or an updated FQR, and that was what was not happening. So that being the biggest issue, I've had that communication and done some education, and I'm seeing a lot less of that already. So really pleased with that process and the help from our IT department in getting that done, and Chelsea for making sure that the process is smooth as well. So really appreciate that. I think the other couple things I would like to say is that we did provide a couple new resource things for our program administrators. One of the things that I did this partially last quarter and this quarter was attended. NCSBN has courses that are available. And I did one on the role of the education consultant in nursing regulatory bodies. And I was able to do that with 11 other education consultants across the US and Canada. And it was a very helpful process, especially in the time that we've had now with COVID and working with our programs, getting a lot of good information and a lot of good networking with other states and seeing what they're doing and how they're handling different situations. And then also was able to ask a lot of questions about their regulations and how it might look compared to ours. And I think that's been helpful. I've been able to, I think, have more information available to administrators on how programs are handling situations that are coming up due to COVID. So that was a very helpful, that was an 8-week course. And SBN has, Nancy Spector is the person who does that. And she's kind of head of their education department and just provides wonderful resources and information. So that was very, very helpful. I think that's the main thing I would like to highlight. Everything else is in the report. There are a few other things, but I think the biggest thing has been continuing to support the nursing programs with our processes and help as they are a challenge to complete clinicals, especially during this time, and to continue to give them information on how they can accomplish that within the regulations. So they've been very complimentary of the Board of Nursing and of the board's support for all that we're doing. And I want you to know that too, as a board, and all that you do to support what we do as staff, and information that we provide to them has been very, very appreciated. So thank you for all that you do. And unless there are questions, that is all that I have for you.
Questions for Janelle? Okay, Janelle, thanks for that. Adrian, I guess I left you to last.
Okay. Thank you, Madam President, members of the board. You should have my report in your packet. It has been an incredibly busy quarter. As you've heard some of the other staff members update, the technology department has been extended out, looking at various different areas to help with the further automation in the investigative and education areas. And I'm happy to hear that some of that's working, and so pleased that they're making progress in the investigative department. I think that's wonderful, and we're hopeful that we can get them a useful system and space and all of that. On the administrative side of things, I've been pretty busy with my NCSBN duties as treasurer. We've had several meetings on that front, doing the various things that are needed for NCSBN. One of those I presented at the IT operations conference on cloud technologies with an individual from the Louisiana Board of Nursing. And from what I've heard, that was a successful presentation, and that people appreciated that information that we provided. On the state front, I've been fairly active with the non-cabinet HR group. It's not a committee, but it's like a work group of people. We're looking at the various policies for teleworking and working through the various COVID scenarios, and working with the state as it pertains to the smaller agencies. And so that's been very helpful. I've also been serving on the Information Technology Advisory Board for many, many years now, but those meetings are happening more regularly, and getting information from the state's Information Technology Office, which is OITS. We are separate in a way that we serve for the Board of Nursing for the new members, but we do have access to OITS for various IT needs. One of those happens to be telecommunications, connections to the internet. They help us manage our firewall services and that sort of thing. So I kind of like to think of us as doing everything from the network side in on the business applications and the day-to-day needs, and then they take care of basically the internet provider and our telephones. And the telephones has been a struggle. I will say that that's been the most difficult part of getting staff remote. The state telephones are a physical device, and they hook to the internet, and they were essentially designed and developed to work on the state networks. So I've been advocating for soft phone technology so that when we deploy the staff laptops, which we've been doing now, we can put this software on their laptops, and they'll be able to essentially answer their desk phone and transfer around like they were sitting in the office. It's a little more problematic when we send those phones home, because some of the rural internet providers don't work so well with the state network. So it's been problematic, and Linda's team's been adjusting and doing the email communications. That's helped out a whole lot. But we would love to get them that technology so that they can make phone calls. Unfortunately, we don't have enough revenue to get everybody a cell phone. And we don't permit them to use their own home phones because they have to abide by the various security policies and whatnot, and to require them to do that on their home phone isn't really something we're looking to do. So the state is implementing this solution. We have received some communications from OITS. They're working with us to try to get that implemented, but we will be the first agency to do it outside of their kind of small group that they're testing with. So we're hopeful that we get that going here in the next couple of weeks. I'm very hopeful that that'll happen, so that we can deploy the rest of the laptops basically to the investigators and then to the education department. So that is a project that's been going on. We're also a little behind on some things because of the COVID situation. Our vendors were unavailable. We were stretched pretty thin to get things up and running, but I'm happy to announce that those are all back on track. So our imaging project is actually being worked on right now. So we're working on upgrading and migrating to a new version of that system and getting the servers bigger, hopefully, to accommodate some of that. And so that's actually going on right now, and we project we're going to be done in January. And then the data center move is one that really got backlogged because we couldn't have staff in the locations to help with the move. And we are at the phase that we're going to be testing that. So when that does happen and we actually do physically move, we're going to have to take down the entire network and everything and physically move those devices that have not been turned off in many years or moved. So you heard some of the discussions about the enhancements to the finances to accommodate that. The network that we have right now and the infrastructure is very dated, and we are noticing some sluggish response times at times with that network equipment. So it really does need to get updated in order to stay current and secure. And on that front with the security, Secretary Burns Wallace was gracious enough to allow us to use a information security officer assigned to the non-cabinet agencies. His name is Nathan, and Jeff Maxson is the new Chief Information Security Officer for the state. And so he's allowed us to work with him regularly. I've kind of taken up the lead to help revise some of the non-cabinet IT security policies. We have found some areas that definitely needed some adjustments on all agency levels. So we're trying to create some of these templates so that other agencies can use them, and then of course the Board of Nursing as well. And they've been working with Tony and Colton to work on our scanning services so that we can ensure that we're secure as we possibly can be. And I'm happy to announce that still is the case, but that's a never-ending thing. And as you might expect during this time, you're hearing a lot of hospitals are being attacked by ransomware. Various hackers are getting into things all over the world, and they're really taking advantage of this COVID situation, realizing that a lot of people are stretched thin. But really, really pleased that the staff are working well on every department. Everybody's been alert. Everybody's going through training. On the technology side, we're keeping close eye on things. We patch constantly. So we're doing everything that we know to do and within our financial means. So we will continue down that path and proceed on as necessary. Let's see. And then lastly, before I stop my report, I did want to make one other announcement, but are there any questions on any of the stuff that I've provided at this point? Okay, seeing none. I did want to make one more announcement. We have filled the Assistant Attorney General position, and you'll see on the screen that Rachel Kinney started with us about a week ago and is working with Will, and we're very pleased to have her on board. Rachel, you want to say a little something about yourself?
Hello. Can you hear me? Okay. It's nice to meet everyone or to see everyone via Zoom. It's been a great week. It's interesting to learn everything that you guys are doing, and I hope to go through that and continue to learn. So thank you so much.
Great to have you join the team. We're very pleased to have you aboard, and the board, you guys will be working with her and Will now. So with that, that's the end of my report, unless there's any other questions.
Any other questions, Adrian? Thanks for that report, Adrian. Did I miss anybody, or do we have any other staff reports? Okay. So I'm going to move right to the next thing, which is the committee reports. And Education Committee is the first one on the list. But because I'm the chair of that committee and going to give that report, I'm going to move the charge of the meeting over to Rebecca Sanders as the vice chair. So I'm going to go through a few things, but Rebecca's going to help us with any of the voting with the motions that we have that are to come. I just want to give a little bit of report for the Education Committee. We're really busy, but some of the highlights that are here, some of the things I'm going to talk about, we have a motion with. I'll let you know what that is. And also, some of this is on the agenda later on for new business, so we'll probably talk about it several other times. One thing, we have had several task force in the past from our committee where we needed some special information to be gathered so that we could make an informed decision. And in doing that, we put a task force together, and those people have met, volunteer, most of them, some of them appointed, have met and brought data back to the group so we could be informed of the decisions we're making. And since we've done that, what we've realized is we have needed some reference as to a written report from those task force, also to include some of the references that they use so that the other members on the committee would have access to that ahead of time, that would be put into the board packet so that the committee packet would show some of the decisions or some of the information that we're bringing back from those task force. So we're shifting just a little bit. I'm going to put some of those things in place. We're kind of piloting, if you will, some formats, and we're going to work with that. I asked Adrian for some of the pieces that they've been using at National Council, which is a pretty good resource to use, and we're going to tweak that a bit for us. But it'll be a written report that will be in the packet, so everybody would have access to that if they wanted to look at what the task force had been looking at and some of the information that they're going to bring back. We had a task force working on an annual report. The charge was to look at and see if we would want to stay with our continued annual report format or to change to something that National Council has on a broader scope, being able to extrapolate data and bring things that we may be able to use in our programs individually, but also from the state level. And so those recommendations were discussed, and there's a motion following for that that we'll read to you and let you know what we decided. Also, discussion was brought up about practice academic partners or clinical partnerships. Some discussion about some institutions that are asking if students under student status might come and be at a facility to help with some of the work and maybe get credit for some clinical pieces. In trying to understand the request for that and also stay within the recommendations or the regulation guidelines that we have from the statutes, that's kind of a tricky thing to do. So that task force is going to look at that and bring back some information, mostly just information gathering so we can have some more discussion, not necessarily a decision that we would make on that, but at least be informed about the information that we're handling for that. So we also have done with those task force, specifically made a charter for them or a charge that they will know exactly what that task force is about. Sometimes when you get on those small teams, you kind of veer off a little bit and start trying to fix other things. And we want to stay as focused on the request that we had from the committee. And they will bring back that information March 2021 and bring those questions back, and we'll have some report for that. Another thing we had was virtual site visits. There's a motion we have in our piece for the Education Committee about whether we would do virtual or face-to-face visits for the spring. There's a lot of discussion about that. As Janelle told you, she did some on face-to-face and in person and some that were virtual. And with the timing of that and trying to get all that lined up for the schools, we have a motion there that we want to put in front of the board members to see if they're okay with how we would handle that for the spring until we have our next meeting in March. One other piece we had was another task force that we had. There's a lot of information that comes through that education committee and not really enough time to take committee time to discuss and look and work through those. So with the task force, that helps sharpen that a bit and shorten the time that we have to be meeting one-on-one, but we still have that information available to us. And this task force is going to look at the educational policies and procedures that we have. Discussion was that we need clarity for some of the processes we have with the site visits for schools, whether that's a focused visit or a conditional approval. And so that team, that focused task force is going to work on some recommendations of how we might put some guidelines together with the algorithm, with some policies, with some templates, whatever that means, so that we can assure everyone across the state that we are being fair to each school and handling them in the same way, although there are individual circumstances always, but a little more of a format so the schools would be able to be prepared for what things that the board might ask from them or want down the road, or where they were really at in that process. So just mostly clarity. And with that, I'm going to let Jill, she has all the motions, so I'm going to let her read those. And then someone will have to second her motion because I'm actually making the motions that Jill is reading. Is that correct, Carol?
That's correct, but I think maybe Chelsea's doing it, correct?
Oh, I'm sorry, Chelsea. Sorry, I let you out of the group. I saw you sitting there too.
That's okay.
I saw Jill panicking, so she's like, what? Okay, Chelsea.
Sure. Is there a board member who would like to make the following motion? It was approved to accept the site visit report for Labette Community College bi-level program, approving the LPN program for a time period of 5 years, and reapproving the ADN program for a time period of national accreditation.
This is Patsy, and I still make the motion.
Do I hear a second?
This is Edric Goldsmith, board member. I second.
It has been moved and seconded. Is there any discussion? If not, all those in favor say aye.
Aye.
Aye. Any opposed, say nay. Motion carried.
Is there a board member who would like to make the following motion? It was moved to accept the major curriculum change request from WSU Tech PN program to include IV therapy beginning January 2021.
This is Patsy, and I so move.
Is there a second?
This is Carol Bragdon, board member. I'll second.
It has been moved and seconded. Any discussion? I hear none. All those in favor say aye.
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 Opposed, say nay. Motion carried.
Is there a board member who would like to make the following motion? It was approved to accept the major curriculum change request from Labette Community College ADN bi-level program to incorporate IV therapy curriculum into Nurse 122 medical surgical nursing course.
This is Patsy, and I so move.
Do I hear a second?
This is
Jade
Juliana,
Ramsdell.
board.
This is Jade Ramsdell, board member. I will second.
It has been moved and seconded. Is there any discussion? Hearing none. All in favor say aye.
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 Any opposed say nay. Motion carried.
Is there a board member who would like to make the following motion? It was moved to accept the major curriculum change request from University of St. Mary MSN FNP and Postmasters FNP program to increase clinical practice hours from 540 to 720 effective January 2021.
This is Patsy, and I so move.
Do I hear a second?
This is Carol Bragdon, board member, and I second that motion.
It has been moved and seconded. Any discussion? Hearing none. All those in favor say aye.
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 Those opposed, nay. Motion carried.
There a board member who would like to make the following motion? It was moved to approve the recommendation from the Annual Report Task Force of the Education Committee that KSBN use the NCSBN Annual Report template for nursing programs beginning with the June 2021 deadline.
This is Patsy and I so move.
Do I hear a second?
This is Juliana, board member, and I'll second.
It has been moved and seconded. Any discussion? Hearing none. All those in favor say aye.
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 Those opposed, nay. Motion carried.
There a board member who would like to make the following motion? It was moved to approve the recommendation to conduct all site visits as virtual visits in 2021 to be reevaluated at each committee and board meeting, allowing the Education Committee and board to request an in-person follow-up visit as needed prior to a decision being made.
This is Patsy. I so move.
Do I hear a second?
This is Andrea Watson. I'll second.
It has been moved and seconded. Any discussion? Hearing none. All in favor say aye.
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 Those opposed, nay. Motion carried.
Is there a board member that would like to make the following motion? It was moved to approve the petition for permission to test retest summary from August 15th, 2020 through November 7th, 2020, which includes Chandra Daniels, Maria Freeman, Erica Hunt, Jamie Lane, Eufoma Uragor, Renu Shrestha, and Gabriela Torres.
This is Patsy and I so move.
Do I hear a second?
This is Gita Noble, board member. I'll second that.
Thank you. It has been moved and seconded. Any discussion? Hearing none. All in favor say aye.
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 Those opposed, nay. Motion carried.
And that concludes the motions for Education Committee.
Thanks for your help, Chelsea. Questions about the report for the education? Okay, with that, I'm going to move to the next committee report, which is investigative committee, and Rebecca and I are going to change hats and I'll conduct the meeting from here.
Well, Madam Chair, we have no action items to present today.
Okay, thank you for that report. That was easy. Let's go to the next one. Continuing Education Committee.
Good morning, Madam Chair. This is Juliana, and we had a good meeting yesterday afternoon. We reviewed a few renewals, and then I believe it was one new applicant for continuing nursing education. So I'd like to make those motions. My first one is it was moved to approve the long-term care provider 5-year renewal application for Hagan and Associates, LLC.
Okay, is that how the motion was written, Chelsea? Do you have the same thing? Or whoever has that?
Yes.
So I have a motion. Do I have a second?
This is Andrea Watson. I'll second.
Motion is second. Any discussion? All in favor say yes.
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 All opposed say no. Any abstentions? That motion carries.
And Madam Chair, I would like to thank Chelsea. She typed these for me, so. My second motion is it was moved to approve the long-term care provider 5-year renewal application for Mid-America Wound Healing Society.
Okay, we have a motion. Do we have a second?
This is
Giovanni
Mandy.
Bonet, I'll second.
Okay, we had several people, so Mandy was a second. I have a motion and a second. Do we have any discussion? Hearing none. All in favor say yes.
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 All opposed say no. Any abstentions? That motion carries.
It was moved to approve the long-term provider 5-year renewal application for TCG Media LLC, pending recommendations made by the C&E committee.
We have a motion. Do we have a second?
This is Rebecca. I will second.
Motion second. Any discussion? All in favor say yes.
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 Opposed say no. Any abstentions? That motion carries.
It was moved to approve the long-term provider initial application for Just Some Podcasts LLC.
A motion. Do I have a second?
This is Adri Goldsmith, board member. I second.
Motion and a second. Any discussion? All in favor say yes.
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 Opposed say no. Any abstentions? That motion carries.
And Madam Chair, we have one last motion for our 5-year legislative review. It was moved to approve KAR 60-4-103 as written as part of the 5-year legislative review process.
We have a motion. Do we have a second?
Andrea Watson, board member. I'll second.
Motion second. Any discussion? All in favor say yes.
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 All opposed say no. Any abstentions? That motion carries. Thank you, Juliana. Does that complete your report?
That concludes my report. Thank you, Madam Chair.
Thank you. APRN committee, Carol Bragdon.
Thank you, Madam Chair. The APRN committee met yesterday at 2 o'clock. We did receive information regarding the prescription monitoring program. The Board of Pharmacy has legislation proposed, KSA 65-1682, to help with regulation and potentially paying for the monitoring program. Our representative, Bobby Mansfield, has been very committed and involved in that committee and reports things have been going well. We did ask that as part of the legislation that the APRN be a permanent position on that board and not just PA or APRN, but we asked for a dedicated APRN position. We'll see how that goes. She did also report that there were very few APRNs that had issues regarding that prescribing. We've received no further information about the CNMI regulations through the Board of Healing Arts. And we have been notified by Amy Seipel, the CAPEN president, that they are planning on submitting HB 2412 for full scope of practice for APRNs with an upcoming legislative session. So more information to come on that next time. At our previous meeting, we reviewed the process for which we approve APRN schools that are out of state. And we found that there could be a 3-month lag in a nurse applying, an APRN applying for a Kansas licensure, depending on when the committee met. So we have authorized our education licensing staff to review those according to the guidelines, and then if there are no questions, to go ahead and offer licensing for those individuals, and then report back to the committee. So that procedure seems to be working well, and we licensed, I believe, approximately 10 individuals in a much more timely fashion. So that has been appreciated. So motions, do we have a motion, Jill?
Sorry, no, there was no motions from the APRN.
I did not think there were, but needed your reassurance.
Yes.
Thank you, Jill. That concludes the report for the APRN committee.
Any questions for Carol? Okay, we're going to move on to Practice IV Therapy Advisory Committee. Mandy?
Thank you, Madam Chair. We didn't have any action items to bring to the board meeting today.
Okay, thank you. You guys are making that easy on me today. Any questions for Mandy? Okay, next, Carol Bragdon. Let's go to the Finance Committee report.
The Finance Committee met this morning. There were no action items, reviewed the budget, and we're doing all right. Thanks to Carol's and Adrian's close supervision of things for our operations. We'll look at the fiscal following New Year's. Carol, did you want to make any comments regarding budget particularly?
I don't, this Carol Moreland, I don't think so, no.
Okay. So we appreciate the good stewardship, and things are on track. And that concludes the report of the Finance Committee. Thank you.
Thanks, Carol. Any questions? Okay, well, my coffee cup is empty, and so if it's okay with everybody, we could take a break. Let's do 15 minutes. So how about 11:05? We'll come back to the meeting and we'll reconvene then and continue with the agenda. Thank you. Okay, this is Patsy Colton. Are we ready to go again? I think it's 11:05.
You are good to go.
Okay, this is Stellar, and I'm going to continue with the agenda for the board meeting for December of 2020 with unfinished business, annual delegation motions. Carol, do you have that?
Yes, Madam President, I do. Thank you. I just want to bring in Jan Art too, because she's going to help explain a little bit of this. I believe she's on. I don't see her. There she is. All right. Okay. Some of you may have remembered in September that we made a bunch of motions that had to do with delegation. And we have to redo like 4 of them because the language wasn't exactly what it should have been. And so I brought Jan in to kind of help explain this a little bit. So if it's okay with Jan, I'm going to let her explain each one. And then I will read the motion for the board to see if there's some board member that wants to make that motion. That work?
Fine. Thank you, Carol. What has happened, to understand why we have to maybe change some of these, would be to have a little bit of a historical understanding. In the past, what has always happened that for emergency proceedings, that it was the chair of the investigative committee who handled them, and then the vice chair who was the alternate. For probably 6 years, I don't know, something like that, the person who was the president of the board was also the chair of the investigative committee. And so that didn't really matter whether your motion said the board president or the board chair because it was the same person. However, that person is no longer on the board at all, so she's not on the investigative committee or the board. And then when you elected your officers, you elected someone who's not on the investigative committee. However, the motion referred to the board's president. And so since you passed that motion in September, that means that board member, I am having a senior moment here. Rebecca Sander, thank you. Has been serving basically then as a person who would handle emergency proceedings. So consequently, I think what we discussed was that to perhaps get this back, well, Rebecca is the chair, and so on the investigative committee before, but what we want to do is to get back to historically like these motions were, so that they said that it would be the chair of the investigative committee and the vice chair of the investigative committee who would serve as alternate for the emergency proceedings. So consequently, what we've done is to amend them so that the first motion that you should be looking at would say, I move that the board designate and delegate to the chair of the investigative committee the board's authority, and then it has number 1, make a reasonable grounds determination under for emergency proceedings, and then to act as a presiding officer for those emergency proceedings. So that would be the one motion, and then the other motion basically then is changing it so that the alternate for emergency proceedings will go to the vice chair of the investigative committee if the chair of the investigative committee is not available. So does that make sense, or does anyone have any questions about that?
Hey, Jan, this is Carol Moreland. Do you also want to talk about the third one that you sent me? That would be if there's a conflict of interest and we needed to have another person serving.
Yeah. Apparently there's been some questions about what happens because you've only got 3 members on the investigative committee. And so consequently, if you have someone who is not available, whether it be that they have a conflict of interest, or even say if they would become ill, or or something should happen that they're not available to participate in a particular proceeding, then you would, what they would like would be to have an alternate so that they have a third person, because with only 3, if one person can't serve, then the other 2 have to have a unanimous decision. So to get back to where they would have 3 members who could participate in that and have, have that more input, they would like to have a motion to delegate someone to be an alternate if one of the 3 board members on the investigative cannot serve as a presiding officer in any pending matter, whether if that helps. It doesn't change the emergency proceedings or the applications. It would just be for the disciplinary proceedings.
Okay, this is Carol Moreland, Administrator. Is there anybody who has any questions before we start with these motions?
There was
Jan?
one more motion. I don't know if
Right.
if you want to cover that now or take these easier ones.
Let's take the easier ones first. How's that?
Okay.
All right. Okay. So I guess I'm hearing no questions. So this would be motion number 15. So is there a member of the board who would like to make the following motion? I move that the board designate and delegate to the chair of the investigative committee the board's authority to, number 1, make a reasonable grounds determination pursuant to KSA 65-1120B and amendments thereto of the Kansas Nurse Practice Act regarding matters that have been recommended for emergency proceedings by staff or council. And number 2, act as presiding officer pursuant to KSA 2015 SUP 77-514G and 77-551A and C, and amendments thereto of the Kansas Administrative Procedures Act to conduct emergency proceedings and issue an order as required by KSA 2015 SUP 77-536 on all matters that are being or have been investigated for any alleged violation of or compliance with the Kansas Nurse Practice Act or regulations adopted thereunder, unless the president determines that the emergency proceedings should be conducted and decided by the investigative committee.
This is Patsy and I so move.
This is Carol Bragdon. I will second.
So we have a motion, a second. Any discussion?
This is Janet. And as Carol read that, I realized we did not catch another mistake. So there may need to be a motion to amend that. On the second part at the end, when you're saying, unless the president determines the emergency proceedings should be conducted and decided by the investigative committee, that probably needs to match the beginning, which would be the chair of the investigative committee determines. So probably we need to have a motion to alter that language. I'm sorry for that it wasn't caught.
That's fine. So I can make that motion to amend the previous motion I just made. Is that okay?
Sure.
Okay, I so move.
This is Carol Bragdon, board member. I will also second that motion.
So now we have a motion and a second with the correct verbiage. So is there any discussion? All in favor say yes.
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 All opposed say no. Any abstentions? That motion carries.
Okay, so this is the next motion. Is there a member of the board who would like to make the following motion? Subject to motion number 15 regarding delegation to the chair of the investigative committee, I move that if the chair is not available to act as described in motion number 15, the vice chair of the investigative committee is so designated and delegated to act as described in motion number 15.
This is Patsy and I so move.
This is Adri Goldsmith, board member, and I second.
So we have a motion and a second. Any discussion? All in favor, say yes.
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 All opposed, say no. Okay, that motion carries.
Okay, this is the third motion that Jan was talking about, and this would be, you just need to provide the name to me before I read the motion about if the chair is not able to, or the vice chair, who would be the next person? I mean, there's only 3 on the investigative committee.
Actually, it would be for any of the 3 board members that are on the investigative committee.
Oh, okay.
So it's broader so that it's, if any 3 of them can't serve, then we have someone to fill that position so that they can have 3 people deciding cases, disciplinary cases.
So it would not be a member of the investigative committee then?
If you're reading the one about if they're unable to serve.
Yes.
Okay, that would be for an alternate. So it would be for any member of the investigative committee who could not serve. So that would be 3 of them, to get someone who's not who is not on the board, then to be the alternate, to be one of the 3 members on the investigative committee. Does that make sense?
So it has to be a board member that's not on the investigative committee.
Correct.
Okay. So,
Well, it sounds like the person's name that needs to be on there is mine, so I guess that's what we need to do.
okay.
You're volunteering then.
I am volunteering, I guess. Yes, I am.
So is there a member of the board who would like to make the following motion? I move that should a board member serving on the investigative committee be unable to serve as a presiding officer in a matter pending before the investigative committee, Patricia Zeller is designated and delegated as an alternate presiding officer of the investigative committee in that pending matter.
This is Carol Bragdon. I will so move.
This is Juliana, board member. I will second.
So we have a motion and a second. Any other discussion? Okay, everyone in favor, say yes.
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 Anyone opposed, say no. Any abstentions? I guess that'd be me. I'm going to abstain. Okay, that looks like the motion carries.
And do you want to explain the last motion then?
Yeah, back in September when you passed the motion that basically was delegating all of the authority to the investigative committee to handle disciplinary matters, that when the motion numbers were written in it, it referred to motion number 37 regarding delegation of applications and motion number 37 regarding delegation of emergency proceedings. And so that clerical error meant that the reference, that one of those references had to be wrong. Number 37 motion, it was actually delegating to the chair of the investigative committee the board's authority to do applications. So the reference to 37 was correct for applications, but the first motion, but the other motion regarding delegation of applications was not correct. And I believe, did we just redo? We did the emergency proceedings and then the other one. So consequently, I'm thinking that what you have, we did not do any motion, redo anything on application. So I'm sorry, again, we may have to adjust that motion. it looks like what the motion was back in September that you did regarding delegation of applications was 30. This is getting messed up. Number 37. Okay, I'm sorry, I've got it switched. So 37 that was passed on September 16. I had them switched, my apologies. So number 37 that was passed on September 16 was delegating to the chair of the investigative committee the authority to do applications. And then what you just did, I believe it was motion 15, was to delegate the emergency proceedings to the chair of the investigative committee on emergency proceedings. So in essence, the motion would read, the first part of the motion would read, subject to motion number 37 that was passed on September 16, 2020, regarding delegation of applications, and motion number 15 that was passed on December 9, 2020, regarding the delegation of emergency proceedings. That's the change, so that we clarify which motions that we were talking about. So this would mean that the delegations for applications that you did back in September stays the same. And the motion that you just did today, December 9th, for emergency proceedings are not going to be covered by this. This is to cover the delegation to the investigative committee to do to handle all the disciplinary matters and to give them the authority to do whatever they need to do on those cases. And my apologies for, I had them flipped, and I apologize for that, but I think that is now correct. Does anyone have any questions, or does it make sense what we're doing? It was just a clerical error in the motion in September, and we're trying to fix it. So now hopefully it should refer correctly to the right motions that were passed in September and today.
So are we clear with that now, or do we need to make another motion to clarify that?
I have a motion.
Yes, Carol has the motion, and
Okay.
basically what I was discussing was to let her know we need to change that motion to read correctly. Because like I said, motion number 37 that passed September 16 had to deal with the applications.
Okay.
So I've got it up in front of me. And then you just passed motion numbers 15 today to deal with emergency proceedings. And so those are we're not changing those. So it's saying we're not subject to those motions. Then you're delegating everything else to the investigative committee. Does that make sense? Carol, you made your corrections so you can read it.
Yes, I believe I have it correct. Are we ready for the motion?
Yes.
Okay. Is there a member of the board who would like to make the following motion? Subject to motion number 37 that was passed on September 16th, 2020, regarding the delegation of applications, and motion number 15 that was passed on December 9th, 2020, regarding the delegation of emergency proceedings, I move that the board designate and delegate to the investigative committee its authority to, number 1, conduct hearings, enter into settlements, issue decisions, and assess fines pursuant to KSA 74-1110 and amendments thereto, regarding an allegation that a person granted a license, certificate of qualification, or authorization to practice nursing has violated or not complied with the Kansas Nurse Practice Act or regulations adopted thereunder. Number 2, make a reasonable grounds determination pursuant to KSA 65-1120B and amendments thereto of the Kansas Nurse Practice Act regarding applications that are being investigated or have been investigated for any alleged violation of or compliance with the Kansas Nurse Practice Act or regulations adopted thereunder. And number 3, act as presiding officer pursuant to KSA 2015 sub 77-514G and 77-551A and C and amendments thereto of the Kansas Administrative Procedures Act to review, decide, and issue any orders on all matters in cases that have been investigated for any alleged violation of or compliance with the Kansas Nurse Practice Act or regulations adopted thereunder. Such delegation includes, but is not limited to, sending warning or reprimand letters, entering into settlement agreements, conducting reviews, proceedings, and hearings, issuing pre-hearing orders, issuing initial orders that censor, revoke, limit, or suspend a license, certificate, or authorization to practice nursing under the Kansas Nurse Practice Act, and taking any action related thereto, unless the investigative committee determines that the matter should be sent to the Office of Administrative Hearings for conducting further proceedings and issuing an initial order or considered and decided by the board.
This is Patsy and I so move.
This is Rebecca. I will second.
We have a motion and a second. Any discussion? Hearing none. Everyone in favor say yes.
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 Opposed say no. Any abstentions? That motion carries.
And that's, Madam President, that is the end of those. And thank you very much to Jan to help explain those. I appreciate that.
Okay, thanks, Carol. We're going to move right next to new business, possible revisions to the quarterly newsletter.
Hey, in your, should have downloaded on your iPads, the quarterly, this is under new business. We put the quarterly newsletter in there just so that you can see what it looks like right now. Just kind of history purposes, this is a quarterly newsletter that used to be mailed out to all of our applicants. However, due to the increased cost of paper and everything for the vendor, they were not going to be able to actually mail it because the cost of paper are much more. Thank you for bringing that up. And so now it is available on our website. You know, we push out through social media and everything that the newsletter is on our website, you know, a new edition of the newsletter and things like that. But, you know, the staff has kind of felt like for some time that we're probably not utilizing this newsletter to the extent that we could as far as communication. You know, we're always challenged to get communication out to nurses. As much as we try and everything, we hear, well, I didn't know anything about that. You guys don't communicate any. We have things on our website, different stuff like that. But we're going to propose some possible changes that we think that might be helpful to this newsletter and make it a little bit more meaningful for the licensees so that maybe they have a better idea of what's going on. And it's another way to get information out there. So we looked at other newsletters that other states do and some things that kind of stuck out from us. Maybe a message from the board president, because I will tell you, some of our nurses have no idea what the board even is about. They see the board as being the agency staff. And so maybe something from the board president. What we're seeing on a lot of other ones is there's a message from, like myself, the executive administrator, you know, different things that we're dealing with in the last quarter, something along that line. Then we thought it would be helpful maybe to have what we called like a practice corner. You know, we can put something in there from the practice aspect. And then something from the education, you know, whether something for the nursing programs. Maybe there's something going on with that, or just something like that. C&E. I mean, we always have some misunderstanding about C&E. So maybe we have a little section that's devoted to C&E. And we have got to be able to put more communication about the Nurse Licensure Compact. There's still a lot of confusion out there. We've been in it now a year and a half. We have tons on our website. We've tried to put a lot of information out, but if we could maybe have a section that just talks about the Nurse Licensure Compact and an update on that or something like that. An advanced practice section that just talks about issues related to advanced practice and what do we want them to know. What we would like to do, and you probably saw this scrolling through, is there's kind of right now what we've done for years and years and years is to put a recap of each committee. And basically it's just a regurgitation almost of the minutes that were approved. So we would like to take those out and just put a link to where they can be found on our website, because all of the minutes are on our website. And that would save some room in this newsletter. We also thought about maybe having a section, how to contact your legislator, because we have nurses who, are upset about something. We explain about the Nurse Practice Act. They don't really understand about statutes, regulations. And they're like, well, I don't know who I need to contact, about getting these statutes changed or something. So maybe we just let them know how they do contact their legislator, if that's something that they choose to do. A reminder about change of address, because again, they are to let us know their change of address within 30 days, but we're finding that doesn't happen. And again, they're like, well, I didn't have any idea about that. We thought about also maybe pulling some scholarly articles from the Journal of Nursing Regulation, National Council's journal, because they publish some wonderful articles. And the nurses probably don't see those. And, we can get National Council's permission to put that information in our newsletter. And I just think that would be extremely helpful to the nurses. And then also another thing that we thought of is a method in which licensees can submit suggestions for improvement to the newsletter, because we'd like to hear what they think would make the newsletter better. We really can't take out all of the continuing nursing education that's more toward the back of it and the advertisements, because that's what pays for this. Because Arthur Davis, who does this, does not charge us to do this, but that's where they get the money to do it, is from the advertisers and the C&E providers who want to put something in there about C&E offerings that they have coming up. So those were just some of the staff's suggestions for what we would like to try with this, but we wanted to run it by the board, see what the board thought. If you had other suggestions, or if you just want us to leave it the way it is now, that's totally fine too. So I'm just open to maybe a little discussion about that, if that's okay.
So some discussion from the group?
Yeah.
Positive, negative?
This is Carol Bragdon.
Go ahead.
Adri, go ahead.
I was going to say, this is Adri Goldsmith, board member, and I think that's a wonderful idea to make the changes.
This is Carol Bragdon. That's exactly what I was going to say. I think those suggestions are very meaningful, and anything we can do to improve communication, this is a marvelous opportunity. We've done it this way for a lot of years. I think people just don't pay much attention to the newsletter, where now we have a new format and in a way, hopefully, that people will be able to read it more readily. So addressing issues, or even perhaps a section where people could write in a question and then perhaps we could respond, or there could be a frequently asked questions. So the questions that you seem to be getting that quarter perhaps could be addressed in the next issue. That would be another way to maybe improve the turnaround of communication with the nurses in the state. Thank you for those efforts.
This is Mandy, board member. I agree with that as well. I also think that having a message from Patsy and from Carol would be a wonderful, wonderful thing. It's more personalized, and it is going to help the nurses that don't know anything about the board or what they actually do. I think that will help a lot. I get a lot of questions about what exactly we do and stuff like that. So I think it would be a wonderful thing to have it more personalized for us that way too.
This is Carol Bragdon again. Another thought I had was perhaps just a description of what each of the committees actually does and is responsible for. That might really help additionally.
I agree with all those comments. Yes, what each committee is responsible for, and some of the conception, the understanding out there is that we are here to protect the nurses and make sure their life is okay. And it's not what it is. It's about the regulatory work. So any way, shape, or form we can help communicate that, I'm all for that. Do you need a motion from us or just a consensus?
I think just a consensus, yeah.
So does anyone have a concern about this change that we're looking at, or some improvements, some changes to hopefully improve? Does anybody have a concern there? It doesn't sound like we do, Carol, so I guess you have our permission. Thanks for that.
Thank
help
you.
with that.
Thank you very much. We appreciate that. Definitely needed, I think.
Okay, that was a quarterly newsletter. Now revisions to the annual report.
Hi, this is Carol Moreland again. Okay, what you're seeing in our screen, this is our annual report in the format that we have done it for. I have been at the board for 10 years and it's been done this way for 10 years. So I can't speak way past then. But, you know, there's some concerns about the way that we're doing this. Some very valid concerns. When you look through this, you'll see there's probably 14 pages that have to do with the history of the Board of Nursing. And it's not just the history of that particular fiscal year, because the annual report covers a fiscal year. So that would be from July 1st until June 30th, not a calendar year, not to confuse it a little bit. But there's like 14 pages of history here. So a suggestion that we have is to take that history section out of the annual report and place it on our website under a section that talks about the history of the board. You know, we do get requests from people who are doing papers or research or something, and they want to know about the history. So we are not trying to hide the history in any way. We're just trying to perhaps make the annual report much more pertinent to that year that it's dealing with. But we would certainly have the history available on our website for those that wanted it. And we could put in that annual report if there's something that happened during that fiscal year that we also put in the history document. So that's one thing that we're suggesting there. When you look through this, you will see that it's just text and data. I mean, it's a lot of data. And you know, what I like to be able to do with the annual report is to refer someone to our annual report to show what our board does, okay? Whether it's a legislator across the street, somebody who's from another board of nursing and wants to know something. You know, I refer a fair amount of people to our annual report, but I kind of cringe each time because I just don't think it looks as good as it could. It's not as dynamic as it could be. To me, this is a very outdated annual report format. And there's another big issue with the annual report, the way that we do it now. And I've said this for several years. We do the annual report on fiscal years. Okay, so the last annual report we have on our website is fiscal year 19. Okay, we ended fiscal year 20 on June 30th of 2020. However, because we put calendar year 2020 NCLEX pass rates in our annual report, You will not see our fiscal year 20 annual report on our website until after the March 2021 board meeting, because we bring the NCLEX pass rates to the March board meeting and report those out to the board first before they're ever published anywhere. And I've done some looking about what other boards of nursing do. And they actually, like for fiscal year 20, they would put 2019 pass rates in there. So then if we were able to make that change, what that means is we know the 2019 pass rates in January 2020. Okay. And so then when we finish the fiscal year on June 30th of 2020, we can have an annual report that talks about fiscal year 20 annual report out on our website in July. And that would be 9 months, well, 8 or 9 months before we do it now. And I will just tell you, I've heard comments about it. I agree with them. I really wish that we could put an annual report out there much faster than we do now. But the holdup is the pass rates. We have all the other data, but we just don't have the pass rates. So that's just a suggestion that I'm throwing out there for y'all to think about. If you scroll on down, you're going to see Missouri's Board of Nursing's annual report. And I'm not saying Missouri's is the one we want to go after, but I want you to see what ours looks like. And then I want you to see what Missouri's looks like. And I think you will see how I really feel ours needs to be much more dynamic. Arthur Davis, who does our newsletter, is willing to do our annual report. So they can do this stuff for us. And I'm not a big proponent of putting pictures of board members or staff out there, just I think with everything going on nowadays, but they do have highlights of the fiscal year. And they kind of look at each division in the agency and what were the highlights that took place. One thing that they do that we don't even do anything about in our annual report is an overview of the budget. Okay. Again, our budget is public information, and it's because of our licensees' fees that we have the fee fund and we're able to exist. And so maybe reporting back out through our annual report, an overview of the budget and how the money was spent and stuff like that might make them maybe understand a little bit. And then I liked how Missouri put in, things about COVID-19, because we as an agency have done a lot and the board has done a lot as a response to COVID-19. We've changed a lot of how we've done things and stuff like that. So I think that needs to be highlighted someplace. Again, I think this looks a whole lot better than how we do it now. Those are just some thoughts that we as staff in the agency had. Just want to hear what board thinks. And I think you can probably see the difference between the two. So just discussion, direction, what would you like?
Any questions or comments from the group?
This is Carol Bragdon, board member. It's time for a facelift.
I see a lot of heads nodding. Is there some opposition to maybe some more changes to maybe improve this process?
This looks great.
I guess a specific question I might have is what are your thoughts about the pass rates and changing how we do that so that we can get our annual report out much sooner after the fiscal year ends? Do you have any feedback about that?
I agree that getting it out sooner would be better.
Yeah, the calendar year for the pass rates is always an aggravation because it is different than our fiscal years. But we do have people testing different times during the year, so I understand why those numbers are gathered in the calendar year. But it is confusing to people, especially college presidents. You know, they struggle with that because we tell them one number that we're pretty sure is going to be, but it's not published yet, so they really can't use it. So anyway, but the rest of that information probably needs to be public sooner, and it's kind of unfair to hold that back, in my opinion. So I think Carol's right. We need a facelift, if that's what you call this. This is a total makeover, I think. Tummy, right?
Yeah, it would look different.
And Madam President and members, one comment I would make is that because we have the new newsletter platform, and if we do this refresh of both of those, we can use them dynamically. So, for instance, when we publish the annual report, it's possible for us to highlight certain sections in those information blasts or send the whole report to all licensees. So I cringe on doing it now. I agree with Carol. It's not as nice as we're accustomed to producing. So just a small comment.
And I also agree with one of the other comments that was made about it being kind of mundane, and people, I think Mandy said this, that people don't look at it as closely with the new eye-catching, or whoever said that, I applaud. I think a new facelift like that will get more audience to look at that at a quicker glance and maybe get that information in a quicker means. So it looks like, Carol, Adrian, looks like you have another green light here. We don't have any opposition, doesn't sound like.
This is Carol Moreland. Would it be okay if we do an overview of the budget in there? Is that okay with board? I mean, what we would do is work on our suggestions for this, and we certainly could bring it back to the board the first time before we, go all gung-ho with this and stuff, just so that you see it. I would probably feel a little bit more comfortable with that rather than just totally overhauling and not bringing it back to let you see it. I mean, what's your thoughts about putting an overview of the budget in there?
I think it's a good idea. Then they
So
know
do
where
I.
the money's going and how it's coming in, and they'll see exactly where we're at. You know what I'm saying? An overview. I think that it would be helpful in general public and nurses understanding, costs and all that good stuff.
Carol, this is Jade Ramsdell. I think it's a fantastic idea. I think, just making it a little bit more dynamic, eye-catching, it's going to call attention to some of those important things that are already known in public. However, now they're highlighted a bit different, they're eye-catching, and people maybe pay attention a little bit more to it. Therefore, we might notice a reduction in some of the frequent calls that are taking place, at the board and some of those things. So I think it's a fantastic idea and a great way to transition moving forward.
This is Mandy. I also think that if we have more of that information, because we know the budget is public and they could go look for it, but a lot of people aren't going to take the time to look for it. If all this is in more of a, one space, one area, and they're looking through it and it's easy read with the charts and the graphs, it's going to be a lot better, I think.
This is Adri Goldsmith. I really appreciate that you've brought these suggestions up about changing both of these areas.
Okay, well, what we will do, we will start working on maybe what fiscal year 20 could look like, and maybe bring that back in March if you want to see it before we get ready for it. Is that what you would like to do?
I think so. That'll make you feel more comfortable, and we can put our eyes on it and then be on our way.
Okay, all right, we can do that. Thank you.
Anything else under the revisions of the annual report, Carol, or are we done with that?
No, I think we're done with that. Thank you.
Okay, the next thing I have here is March 2021 committee and board meeting, virtual or in person. I think the question was, how did the group feel about making that decision today about how we would meet in the next quarter? Any conversation about that?
Madam President, this is Juliana Reshake, board member. I do think we've lost some aspects of our meeting by transitioning to the virtual platform. And I am excited to get back to an in-person format. We are on the cusp of vaccines, and I think that potentially could change our historic position of being virtual for the last year. I'm a little bit fearful to make that decision today, just because we are not certain how the vaccines will impact our workforce. But I'd like to think we're getting close. So I really have mixed feelings for March. There's a piece of me that would like to say, let's do it in person. I might feel more comfortable saying that in the next 2 weeks to a month, but that's kind of my view of the world.
This is Board Member Gita Noble. I agree with what Juliana said. And to follow up with her concern for maybe not knowing what to do exactly for March, is there a way to offer a hybrid meeting where those of us who feel comfortable coming in and on site can do so, and those who may be impacted differently log in virtually? Just a thought.
In the past, some of the concern has been for the board, for the staff themselves at the agency. And the issues that might be if something was brought to that group, then there might be problems. Several people were unable to work. That would pretty much shut down the agency. So I think there was consideration there. Also some consideration with travel. Sometimes the struggle is putting off the decision until a little before, then it is a confusion for everybody. That's why it's on the agenda to have that conversation now. And if we could make that decision, I agree with Juliana 100%. We have lost something with working by Zoom. When we meet in person, we get to know each other a little bit better. We understand the system. We can answer questions immediately when they arise, not interrupting the Zoom or interrupting each other on the Zoom. So I agree with that. I too don't have a crystal ball that has enough superpowered batteries in it to really know what's going to happen in the next few months. And I'm a little bit skeptical with that. And because of all the cautionary measures we have made up to this point, I kind of hate to jump too quick, but it's really the group's decision. I mean, if we decide we want to try to meet, then I guess we can do that. I don't know. I see Jan has her mic off. Jan, do you have a comment?
Well, really, a lot of this may be out of the board's hands because the Shawnee County Health Officer does have health orders out about meeting in public. And you also have, and Carol may have to correct me this, but you've used to meet in the past a conference room on 5th floor of the Landon building. Those have been closed, I understand, for meetings. So if if the state does not open up their conference rooms so that you can accommodate social distancing for groups, or you're not going to be able to do it in person. And you have quite a few people that do attend your meetings. And so by the time you get board members in there, staff board members in there, and then the public in there, I don't know that that room is large enough to do social distancing, even if they would open up that room. So I think it's really, if you can even meet in person, is going to be dependent upon what health orders are in place for Shawnee County, and if the Department of Facilities has opened up conference rooms for public meetings. So I think it might, if they would open it up, you might be able to have some kind of a hybrid where some of the board members were in person at the board, at the conference room, and others and the public appeared by Zoom. But, until we get further along, I don't know, so you can make it a final decision today, quite honestly, because if you would do with the health orders or to find a state office that has a conference room available.
And Madam President, I'd echo some of those comments. That was some concerns that I had initially, whether or not we could set up the new room. The conference room has been remodeled, so we're not familiar with the setup just yet, and whether or not we could accommodate that for social distancing. And if not, then we would need to get other locations that would have some telecommunications potential restrictions, and whether or not we could accommodate those areas to set up the iPads and email or internet and phones might be problematic.
Madam President, this is Carol, and I'll just speak to the one point that was said, and that as far as agency staff, I would not be in favor of bringing all of our leadership group agency staff in one room at this early on in the stage, just because if there's an exposure, it takes out the leadership team. And that's something we've tried very hard to keep us separated and not physically together. We do a lot of Zoom meetings and a lot of talking on the phone and stuff like that. But it's just been very, very important to not get everybody exposed at the same time. So that's just my thought there. I mean, we could have some in person and some join by Zoom if you know you're thinking. But I agree is we could not use the conference room on 5th floor, even if we were allowed to use it. There is no way we could social distance the board, the audience, and everything else down there. It would take something much bigger than that. It really would.
This is Carol Bragdon, board member. As much as I miss seeing all of you and having face-to-face conversation, oh my goodness, I miss it. And I do think our meetings run much more meaningfully when we are together. However, I think we need to be data-driven. And I think at this point, we do not have data to tell us that the vaccination program is working. And I think that needs to be our driving force. We've got to have data to say it's safe. And I just don't think we can project for March. We may be able to say in March that yes, June is feasible. And I suspect, again, I'm like Patsy, I don't have enough batteries in the crystal ball, but I suspect by June we will have enough of the population vaccinated, hopefully, that it will be more reasonable to come together. And at that point, we may have the appropriate county recommendations so that we can. But I just have to say, I think March is, as much as I want it and as much COVID fatigue as we're all suffering, I think we have to be patient and see this thing through. And March, unfortunately, needs to be right where we are. Thank you.
That would be, this is Juliana Reshik, board member. That would be consistent with the lead of NCSBN and their meetings. They're planning, as we said earlier, the mid-year in March is virtual. And then hopefully the annual meeting in August would be in person. So that would be consistent with what they are doing.
Yes, we're not having face-to-face meetings currently.
So how does the group feel? Do we want to step out there and say, right now we'll plan on a virtual meeting for March and then make another decision for the next few months? Is that where we want to be today?
I'm in favor of that.
If we have some concerns about that not being the way we want to go, we need to hear that now. It sounds like, Carol, that's what we're wanting to do. We'll put what we want to do, but what we probably think is the best choice at this point to make March meeting virtually. And then we'll see if we can have a party in June. Social distance, of course, probably still. Whether that's hybrid or what it is, we'll make that decision when we get to March.
Right, thank you.
Okay. So now we're at the point where we are ready to go to executive session that Jan is going to help us with. Is that correct, Carol?
Yes, that would be executive session number 1. And I did email out to all the board members the conference call number and some documents that you would want to refer to. And then when you're ready, Jill has the motion that you will have to pass to go into executive session. And part of that information is going to be how much time you think that you need. She's got to know that to read the motion. So Jan, what do you think as far as the amount of time?
I'm kind of thinking about an hour. I see Will is on the line. And he's going to help us with a lot of the discussion. Do you think that would be appropriate, Will, about an hour?
Yeah, I'll defer to you, Jan, but that probably sounds appropriate.
I mean, it is an executive session. Once we make that decision, if it takes less, we can't come back until that time has expired. But if we find out that that's not enough, we come back and we can do another executive session to finish the discussion. But I think probably about an hour, just at least to begin with. I'm sorry to say.
Okay, Carol, then you want to read that motion so one of us can make that?
I think Jill has it.
Okay.
Is there a board member who would like to make the following motion? Pursuant to KSA 75-4319, small b 2, I move that the board recess into executive session for 60 minutes and reconvene at 1 p.m. The remote meeting will be reconvened by Zoom and YouTube as stated in the notice of the meeting that was sent to individuals who requested the notice and as published on the board's website, www.ksbn.kansas.gov. The justification is consultation with the board legal counsel, assistant attorneys general, Janet Art, Will Snipnick, and Rachel Kinney that would be deemed privileged in the attorney-client relationship. The subject matter to be discussed in the executive session concerns legal issues regarding discipline under the Kansas Nurse Practice Act. The board's executive administrator, Carol Moreland, is included as the client.
This is Rebecca. I will make the motion.
We have a motion. Do we have a second?
This is Adri Goldsmith. I second.
Motion is second. Any discussion? All in favor say yes.
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 All opposed say no. Any abstentions? Okay, that motion carries. Okay, from here you go to the phone number that you were given. Call in and this will all be put on hold with microphone and we'll come back at 1 o'clock.
Phone mute.
And one side note, please turn off your video.
Okay, Colton, this is Patsy Zeller. Are we back in the main session meeting?
You should be good to go.
Okay, we're reconvening the meeting after the executive session. And the question that we have here is, do we need to go back to executive session with some more time for further work on this, or where are we at with this? I heard the comment about discussion. Some more of our discussion needed to happen outside of the executive session. So Carol Moreland, will you help me here? Do we need to go back to executive session, or do we need to save the discussion for another day, or do we need to have it today? Where are we at here?
I'm not sure we're actually at a point for the board maybe to discuss this. I don't know, maybe Jan can chime in here, but I think if you feel like you need more time for legal advice, then it would go back into an executive session. And that's kind of up to the board members, how they feel about that.
Okay, so that's the first question on the docket here. Do we feel like we need to go back for more legal counsel, or are we done with that? Have enough information and that we would maybe head to discussion, whether that be today or another day when we're more prepared for that?
This is Juliana, board member. I don't feel that I need any more legal counsel. I will wait for discussion at a later date.
Rebecca, I'm going to kind of,
Yeah.
more legal counsel. Are you good for discussion at a later date?
Oh, yeah. Today was only to explain from legal what we were looking at, and we will bring these forward at a later date. Right, Jan?
Correct.
So is it something that we probably should put on the next agenda, that we would have some discussion of this at the next board meeting? Is that what we need to do?
Yes, I'm pretty sure we'll be ready by March to present for
Will,
discussion.
how do you feel? I'm curious about that. Will, are you going to be, how are you feeling about that? Would you rather do it? Are we going to be far enough along to do it in March, or do you think June?
You kind of stuttered out on me there, but I think because we have the time, it might be wiser to set that for June.
So as I understand it, the discussion of any other questions that we would have, like Juliana just spoke about a few minutes ago, all that would be put on the June agenda for the June meeting. Is that correct? Is that okay with everybody on the group here today?
That's correct.
Okay.
It has to be an open meeting, as Jan said. It has to be an open meeting.
Okay, so June it is 2021. Maybe we'll be face to face by then. Who knows? So that's what we'll do with those. So Juliana, I guess you're going to write down your questions so you don't forget those before June, right? Okay, so the next thing we have on here is board member training. I know Jan is going to do that. Carol Moreland, help me out with the timing of this. We've been at this another 2 hours. Do we need a break and come back and do that because we have another executive session after that? Or what about the timing?
And how much time do you think this will take? Just a guess.
Depends on how thorough you want me to be. At a minimum about 30 minutes, but probably to kind of cover because we have so many new members, if they would kind of have questions, because I do want them to ask questions if they have any. I would say maybe about an hour.
Okay, so if Jan, if you would entertain the idea that we took a break here for just a little bit and then came back for that because we have some more agenda to handle.
Yeah, and I mean, if you wanted to, that other executive session, I don't know how long you think it will take, but I mean, you could even do that before the training too, so that, that would be over with, try to get more stuff off of your agenda. It's entirely up to you.
Okay, so if we took a break, does everybody 15, 20 minutes, or do we need to take a half hour? Everybody needs to tell me because we have to get through the agenda today, no matter how long that takes. So help me out with some decisions here.
Executive session might be more important than the training. I don't know. Because I could always go really fast at the end of it if people need to leave.
Well, I think we want to check the boxes off and make sure we get all the information that we need, especially with the new board members that we have. So we probably need to take that time. So how about I suggest we take 15, or do you guys want to take 30-minute break here? You tell me.
I think 15 minutes is fine.
Okay, let's do a
I
15.
support that.
Come back, and then Jan will start with your board member training, and then we'll continue with the agenda as planned.
Okay.
Minutes makes it see, I'll get to my clock here. 1:25. We'll be back at 1:25. Okay, Colton, it's 1:25. Are we back in session?
You are good to go.
Okay, so I'm going to bring the meeting back in session, and the next thing we have on the list is board member training. And Carol, do you need to introduce that or how we do this?
Yes, I certainly can. I just want to tell you that Audrey sent a chat that her video is not coming on. So maybe she'll be joining us here in a minute. But anyway, the next part is the board member training. This is something that we try to have done every year. And I think it's really important because of all the new board members. But Jan comes and does it. And so I think you're going to find it very helpful.
And I guess we'll get started. We do, like Carol said, there's a lot of board members, so there's some faces here I'm not familiar with. But just as kind of let me give you a little bit of background about myself so you kind of know where what I'm about. After law school, I was in Wichita where I had various jobs. I was a city prosecutor. I was in private practice. I then became a municipal court judge for the city of Wichita. After that, then I worked for 9 years for the Court of Appeals as a research attorney. And then I joined the Attorney General's office, and the division that I am in is called the Legal Opinions and General Counsel Division. So that means that the attorneys in our division, we don't handle your litigation. We don't actually litigate, but we give you legal advice in the hopes that, one, you won't have to litigate issues. So our purpose is kind of to try and keep you out of trouble and to also be there when you do have issues about how can we, handle this type of thing. So that's where we're at. So I began, I was assigned the nursing board in May of 2007. So I've been with you for over 13 years, and it's been a real learning experience. And even as Carol can say, every now and then new issues come up that I've never had to address for the nursing board, and we have to kind of try and figure all this out. So, it's a never, a regulatory board is, and licensing board is, can be a lot of work, especially if you're on the investigative committee. So what we want to do today is to kind of give you an idea of what the scope of your authority is and how you have many acts, not just the Nurse Practice Act, that applies to you. And so I want to make sure that you understand what some of those acts are and how they can affect what you do as a board member, and also how your roles may have to collide. The first thing I want to, as a board member, you've probably been active in your profession. Most people have somehow, they have feel a sense of duty to their community, to their profession or whatever, to serve. And so that's that type of a person. So what that can often bring is that you need to always remember, what hat am I wearing when I am a board member? So as a nurse, you may be an employer, you may be an employee. You may also serve on other boards. You may serve in a professional association. So those are different roles, and sometimes they kind of have a tendency to want to blend together, but you have to be very careful not to do that. When you are with the board, you are representing the board. You're not representing yourself as a licensee. You're not representing other licensees. You are not representing a professional association. You are representing the board, and you are carrying out the duties of the board. And the overarching duty of the board is to protect the public, not to protect the licensees. And licensees don't understand that, but as a board member, you have to understand that. So that is your focus, is what are we doing? Is what we're doing going to protect the public? That's where we all want to aim for. So how do you do that? Well, you have to know what your authority is and what it is not. typically what happens is that board members say, well, there's no statute that prohibits me from doing that. Or what statute does prohibit me from doing that? That's the wrong question. The question you need to ask is what statute gives me that authority, either expressly or implicitly. Because what the board is a creature of statute. What that means is that the legislature has the power to enact laws, but they have created the nursing board to regulate the nursing profession. And so the way they have set forward on your authority has to come from statutes. And so you have to look to those statutes to see what you can and cannot do. You've got the Kansas Nurse Practice Act and the Licensed Mental Health Technician Act that you are over. So those are the two big acts that you really need to concentrate on. Another one is what is referred to as your enabling act. And those are your statutes that are in Chapter 74. That is where the board is created. It says how many members are on the board, what kind of a license they had to be, how long your term is, and what authority they have should just to issue to contract with other entities or persons, the authority to license people in certain professions, investigate complaints. So that's your enabling act that creates you. And so that's in Chapter 74. In addition to statutes, you have some constitutional limitations. And usually those are going to come from the doctrines of fundamental fairness that come from equal protection and due process. Equal protection means that you are treating people similarly situated in the same manner. Due process is that you are following a certain procedure in order for them to have the opportunity to be heard before you do anything to the license. So and for due process, there's two kinds of due processes, the constitutional one, but then we're also going to talk a little bit later about the Kansas Administrative Procedure Act. That is also a due process, but it's a statutory due process that the Kansas legislature has created. And so if you have the authority to do things under CAPA, if you follow CAPA, you're probably not going to have any issues about due process. So that's very important to kind of understand that. So, so what you want to do is to make sure that people that you license, they're competent, they're trustworthy, they're not unprofessional, improper, and they're not going to do anything that's not authorized. And so how do you do that? It's going to be that who you give your license to, and then who you would discipline once they have the license. So there are different ways you can do that. As a licensing board, you have three governmental functions. If you go back to your civics classes, you may remember that the government's kind of divided up into three different branches. You have your legislative branch, your executive branch, and your judicial branch. The executive branch is usually how you administer things. Your judicial is making decisions on cases. So it's kind of judicial. Then legislative is enacting laws. Legislative kind of is more of your authority to issue regulations, because if they're done properly, they have the authority to have the effect of law. So what you need to, and regulations do have to follow a certain procedure in order to be effective as law, and that is set out in the Rules and Regulations Filing Act. And as Carol can tell you, that is not an easy hurdle. It can take time. Regulation doesn't get passed overnight. It doesn't get passed in a month. It can take months to get one passed and become effective. So as I said before, what we want to do is to make sure that you're efficient and that we don't have any kind of legal issues. So the best thing to do to make sure that you understand what your authority is to read your statutes. Read them and reread them. And if a particular issue comes back up, reread the statute. Why? Because sometimes your statutes change. And so what was applicable 10 years ago may no longer be applicable. So that's why you always want to go back and read your statutes to make sure they're still the same, that there hasn't been any kind of change in them. And if you have questions about it, always contact one of your assistant attorney generals to get legal advice. Also, you need to watch out for your policies that you may have or any internal procedures to make sure that they don't conflict or they're not inconsistent with any statutes or regulations that you have. If you get sued and your defense is, well, this is the way we've always done it, which unfortunately I hear, it's not a legal defense. Get prepared. We're going to have an uphill battle. So make sure you understand that what you're doing and why you're doing it that way complies with the law. The other thing I would have to say, when you look at your statutes and regulations, make sure that they're current and that you understand them, because if you can't understand them, then probably the public or your licensees aren't going to be able to understand them. So don't ever feel that you need, or you may just say, this is an outdated procedure. Nursing hasn't done this for decades. So consequently, what you need to then think about is, do we need to change our statutes or our regulations to get them updated or to make them clear? If so, then take the necessary steps to do that. Don't, stick your head in the sand and ignore them, because the issues aren't going to go away. Conflict of interest is something that can happen as a board member. Like I said, you have different roles in your life. You're not just a board member. So if something happens as a board member that you feel that you have a conflict of interest, you need to make it known. And then you also would have to refrain from participating in any decision so that you're are doing your duty to reflect the board and not your personal interest. Sometimes it may be that your conflict would have to do with the personal gains. So that somehow, if you would be an employer and something would happen that it would change the way you do business, that you would want to vote a certain way so it helps your business, you need to refrain. Another way would be that as on the investigative committee, let's say that, again, you have like a nursing business and someone comes in and there's another competitor in that area. And you know that if you were to vote a certain way, it would hurt your competitor and be better for you. You need to step aside. Others may be a personal relationship, such as it involves a family or close friend, so that you feel that could influence your decision, then you need to think about stepping aside. So those are, there is no clear definition of what a conflict of interest is. So I can't point you to a statute and say, hey, this is it, because it could vary so much depending upon the circumstances of your particular case. So if you think that you have a conflict of interest, again, contact the attorneys. They'll help you walk through that and help you to decide, yeah, I need to step aside, or, oh, no, I'm overthinking this, or whatever. I can handle this. But it is your decision to decide whether or not you have a conflict of interest. And, sometimes it's just the appearance of a conflict of interest. How is this going to look? Is this going to look like I'm using my role as a board member, to gain something? So sometimes the appearance of conflict of a impropriety can be enough that maybe you need to go ahead and step aside. So don't ever hesitate to do that. And again, it's a decision that you will have to make as a board member. Confidentiality is another big issue with board members. There are a lot of information that you will get confidential information. And if you're like on the investigative committee, you're going to be getting a lot of confidential information regarding complaints or applicants, and you should not be discussing those. Another one is executive sessions. If you have executive sessions and you have a discussion during that executive session. Don't come back out of executive session saying, hey, you know what we were talking about, in that executive session, here's what I think about it. Because what happens when you start to discuss something in an open meeting that has been discussed in an executive session, you're going to get a COMA complaint, which is COMA's Kansas Open Meetings Act, which means that if that was something that you could discuss in an open meeting, then you didn't need to have that executive session and you should not have taken it. So you need to be very careful. If there's an executive session, there's a reason for it. You're discussing confidential information, and so it needs to remain confidential. And that confidentiality stays with you. It's not just while you're on the board. Once you leave the board, that confidentiality remains. For purposes of like a legal consultation, and you could legal advice to waive that attorney-client privilege, one board member cannot do that. That would have to come before the full board, and you'd have to have a majority to vote to release that confidentiality. So consequently, just because you want to release it doesn't give you the authority to do that. So be very careful. Another one is, like I said, is especially if you're on the investigative committee, your quasi-judicial deliberations, you get a lot of information in there that's very private. And not only that, but just the fact of your deliberations are private. So consequently, the public doesn't get to know, well, this board member voted this way, this board member voted that way, this is what they liked, what they didn't like. Those are quasi-judicial deliberations, and they are protected by law. Ex parte communications, this is typically going to happen with people who are serving on the investigative board, where you are discussing something with an outside person who's not a part of the litigation, and you don't want to do that. It's a very bad idea, because then when the other side, one, you may gain information that the other side doesn't have, or that's not in the record that before you, and you're using that knowledge to make a decision. You have to base your decisions on the information that you have in the agency record or that you get from witnesses. And so when you start discussing it with someone else, then you have had an ex parte communication. So be very careful about that, because it applies broadly, but also if you are under the Kansas Administrative Act, there is a particular procedure that covers that, or a particular statute. And if that occurs, you have to put it on the record that you had an ex parte communication. You have to tell all the parties what that ex parte communication was. And then that way, if a litigant thinks, I don't want that person on my case, they have the opportunity to ask you to step aside. So again, you have to be very careful what you're talking about as a board member. It's very common that licensees or the public, once they find out that you're a board member, they're going, hey, tell me about this case. I know you got something going on. You can't discuss it. And that's what your answer is sort of going to be, is I can't discuss anything that until a case is resolved. Even if you're not on the investigative committee or on the investigative committee, it's sort of like when there's a criminal case that's pending and all of a sudden the attorneys and the litigants all come outside of the courthouse. There's all these cameras and they're trying to get comments, and the attorney goes, no comment, no comment. Why? Because it's unethical for them to comment on potential litigation. And not only that, but they don't want to have some comment that they did make to hurt the case. And so that's why you don't comment, talk to other people about a case, is because you don't want to hurt a case if it's pending. And also you don't want to reveal any confidences. So it's just no comment. Can't talk to you about it. And again, professional associations, you're not prohibited from, being involved in your professional association, but remember which hat you're wearing when you are for the association or for the board. Also, if there are more than one board member on it, you have to be very careful if you're going to professional conferences or social events where there's several board members, because if you reach a majority and you start to discuss board business, you have a COMA violation because COMA requires notice and that they be out in the open. So if you are at a meeting where other board members are present, the best rule is do not, even if it's less than the majority, don't discuss the board business. That's not the appropriate place. Put it on an agenda and discuss it at the next meeting. The other type of conduct often occurs when you've been asked to speak on behalf of the board. Typically, if you're as a board member, you don't speak on behalf of the board unless they have authorized you to do that. This may occur to go to a professional association. It may be to go to the legislature. It may be to give a press release. But until the majority of the board passes a motion that gives you the authority to be their spokesperson as a board member, you're not speaking on behalf of the board. So make sure that when that occurs, when you're speaking someplace, that you say, this is my opinion. It's my personal belief. I am not speaking on behalf of the board. And then everyone knows that this is what you're talking about is based for your opinion, your beliefs, and not the board. But make sure that that's really clear. So that's just kind of the overview, the Rules and Regulations Filing Act. Carol's probably given you a manual that has all the statutes and all the regulations. So the regulations are basically, like I said, they have been passed, and so they are now have the force and effect of law. So, but there's you have, in order to do a regulation, you have to have a statutes. So first of all, you have to identify, do we have a statute that authorizes this regulation? Authorizing language in a statute is typically the board is hereby authorized to adopt regulations to implement, administer, and enforce this act. Or they have the authority to adopt regulations to administer this section, which means a particular statute, not the entire act, but just that statute. So that's the kind of the language that you need to have for that part of it. The Rules and Regulations Filing Act also requires that you have an implementing statute. An implementing statute is basically, if you think of it as subject matter, so that what they're talking about in the statute is the same thing that you're going to be talking about in your regulations. The two of them mesh up together. They're consistent. So if there were statutes talking about A, B, and C, but your regulation is about X, Y, Z, your regulation isn't going to get passed because you're not implementing the statute that you have cited. So when you're looking, as I stated before, look at your regulations and see, do they need to be updated? Is there a need for a regulation or a need to amend a regulation? Not everything is a regulation. The definition of a regulation is it's a standard or requirement. Does say other policy of general application that has the force and effect of law. It includes revocations or amendments of a regulation. And the regulation will be to implement or interpret the legislation. So you may have a policy about that it's internal for your staff to follow, but that doesn't mean that it's a regulation under the Rules and Regulation Filing Act. So if you want it to have the force and effect of law, you have to have it in a regulation. The other things that are looked at for a regulation, there's no point in repeating the statute. The statute's already law, so don't start making, doing that. If there's something more, sometimes you have to have what's in the statute to make the regulation understandable, and that can be allowed, but just to repeat the statute, no, you're going to be told to take it out. The other thing is it purely self-directory? Usually that is like the board shall do this, the board shall do that. In other words, you're telling yourself what to do, not the licensees, not the people that you are regulating. So make sure that your regulation is addressing the licensees or the person you have the authority to regulate, but not yourself. And then is it informational rather than regulatory? So if you're just saying, you know, we suggest that you look at this pamphlet put out by this association, that's informational, that's not regulatory. The procedure is long and time consuming. It can be time consuming. And that's because you're making law. And so consequently, they have to go through a whole process, and the public has to be able to look at that process and to determine, you know, make comments on it. So some agencies do this from the very beginning when they're drafting them. Some wait till it's drafted and do it at the other end. But initially, once you have it, start drafting it, it has to comply with the Department of Administration's form and style requirements. And that's not an easy thing to do. It's a little different. It's a very particular writing style. It's kind of a combination of a outline and a paragraph form. And so a lot of people struggle to get that style. Other people, it comes very natural, but there is a style that you have to follow. Then once that is done, a new thing that's in the in the Rules and Regulation Act that they enacted just a few years ago is an economic impact statement. That means that Carol or someone there at the board will have to prepare this, and it goes through, and it's about several pages long, and they have to answer every question that talks about the economic impact on the agency and the people it is regulating, and how much money do you anticipate it's going to cost, and if it's over a certain amount, have you done this, have you done that? And that has to go to the budget office to get stamped that they approve the economic impact, that it's okay. You're not going to have anything to do with the environmental, so you won't have an environmental impact statement or private property protection act, because you're not going to be taking away someone's private property. But the budget office economic impact statement is something new that has to be done for everyone, not just every regulation, not just the new ones, but in addition, some ones that you're amending and revoking. You can adopt documents by referencing this, and if you do it properly, then that other document will become law. Oftentimes, this is seen for licensing standards, education standards. They will adopt a professional association's model act that has, these are the standards that education that someone should have. You can do that, but you have to, there's very careful how you have to do it, because it's someone else's document. They can change or alter that document at any time, which you cannot have when you're going to make this have the force and effect of law, because then that changes the law. So you have to say, we're adopting this regulation that was published by this entity, and it was on this particular date. So you have to limit it to a particular date, because then it becomes like etched in stone that those are the standards. And even though that other association may later change, amend, or delete that document, it doesn't matter, because you have set that this is the standard you want. And until you amend that regulation and adopt some other standard, that will remain in effect. You also, if those other documents, if there's things in there that go outside of your authority as in your authorizing statute, your implementing statute, it all has to be stricken or amended, revised, so that you have the correct language. Once you've done all those things, then you're going to submit the regulation and the economic impact statement to the budget office. They stamp everything so that then it goes on to the sequence has to be done in the correct order. The next step is to go to Department of Administration. They then review it for style, grammar, all of that stuff. Mary Greb Hall's been doing this for decades, and she's got a PhD in English, and she's very picky about the way she wants her regulations done. So if she wants you to make any changes, then what happens, you've got to go make those changes, and then you have to resubmit everything again to the budget office and then again to Mary. So once you finally get the stamps from the budget office, department administration, the next step in the procedures go to the Attorney General's office. Our office does a two process review. One, what I mean by that is there's two attorneys that review every regulation. They're going to review it for, as we discussed just a while ago, about authorizing statute, implementing statutes. If you adopted by reference, is that document enclosed, attached, so we can review it? And did you go in and correctly change anything in that document that needed to be changed so it was within your authority? We also look for constitutional issues. Is it vague? Does it make sense? And if we say doesn't make, you've got it too vague, or we think it's arbitrary and capricious because you're giving yourself way more authority than you have, or that so that people don't know what they need to do to get licensed or to get action, then those things, we're not going to approve it. We'll send it back to you. And then if we send it back, then again, you've got to fix those changes. It goes back to the budget office, back to Mary, and then back to us again to get approval. But once you have finally got all three stamps on your regulation, then it can go over to the, over to the Secretary of State. What that does is in the Secretary of State, they will put you on the agenda for, if it's a permanent regulation, for the Joint Committee on Rules and Regulations. If it's a temporary regulation, then it's going to be to the State Rules and Regulations Board. They will also publish. If it's a permanent one, it will get published, and then within 60 days that publication, you have to have a public hearing. So, but before that public hearing, you're typically going to go over and meet with the legislature on this permanent regulation, and it's probably going to have to be Carol. She'll have to go over and talk to them about what it is and explain it to them, answer their questions. Sometimes that can be like being on a hot seat. Once that, but they don't have the authority to say, no, you can't do this regulation. Nevertheless, you may she'll probably get a letter and say that, the committee's reviewed it. These are things that they would like you to consider before you adopt this. And you can, and so that when it comes back to the board is made, and then a public comment, people present testimony, and that's all, it's open to the public. So then it comes back to the board, and you will be told this is what the legislative committee said, and this is where the public comments. Do you want to make any changes to your regulation? If you do, then it starts the process again over about getting them approved. If you don't, then you will then do a certificate that shows there was a roll call vote, and it will show how each and every one of you voted on that particular regulation. It goes to the Secretary of State, they publish it, and then 14 days after publication, it becomes law. So that's why this process can take so long. It can take, if everything goes smoothly, hopefully maybe within 6 months. If things keep having to go back and forth, you could be talking a year. So it kind of depends too on how complicated they are. Fee statutes usually go pretty fast if that's the only thing in your packet. Other things can go pretty slow. The other thing would be is if the committee does make comments that, hey, we want you to make these revisions, and you say, no, we're not going to. The downside of that is the legislature does make statutes, and by statute, they could change it so that consequently what you did in your regulation is no longer law. It becomes null and void because they disagreed with you. So that's the downside. Other agencies have gotten budget cuts. So when they say something, take it very seriously and consider, oh, well, maybe this is something we need to look at. But I mean, usually they're not anything outlandish. And a lot of times they just want a written explanation of something. So that's how you make law as board members, is through your regulations. The Kansas Tort Claims Act. Unfortunately, board members do get sued. And you need to be, I don't want to scare anyone off like, oh my God, I never knew that. But yes, it doesn't happen very often, but occasionally you do. So this is where the Kansas Tort Claims Act comes in. If you do get sued, what they are suing you over needs to be within your scope as the duties of a board member. So when I went through earlier and said, make sure you understand what your statutory authority is, that's where this becomes extremely important, because if you are operating within your scope as a board member, then you come under the Kansas Tort Claims Act. If you are being willful and intentional to disregard that, you could be outside of that. And the reason that's important is because there's some protections. Number one, if you're inside of the act, of the Kansas Tort Claims Act, and you get sued, then the first thing you need to do is to contact the Attorney General's office. It's the deputy of our civil litigation. Say, I have been sued. I was served on this date. I want representation from your office. And then give them copies of the petition and the summons. And then they will look everything over. They will verify it. And then they will enter appearance and they will be representing you. If they look at it and say, no, this was something that you should never have done, and why in the world you thought you had the authority to do it, we can deny representation. If it's also if what you are doing is a discretionary act and it's within your authority, then there's, chances are there's not going to be any type of penalty, no monetary damages. But when you get outside of that and you're willfully disobeying something, there you're looking at, you could have some damages, and it may, and the state, in those instances, the state can refuse to pay the damages. So that's why I say it's be very careful in knowing what you can and you cannot do. So even if you're sued as a board member, if you leave the board, so you're no longer a member, but you get sued for something that occurred while you were a board member, this protection still will apply. So consequently, if you're not on the board, but it's something about what happened as a board member, then again, get a hold of the Attorney General's office, let them know that you've been served with a lawsuit so that we can start handling it for you. Once you've done that, don't sign anything, don't say anything. So consequently, once they find out if it's some hot case, if the media starts contacting you, this is a really biggie. Don't say anything. Do not say anything. And also don't sign anything, because that can really be detrimental to handling the case. The Kansas Open Meetings Law, right now you're having your open meeting. It is governed by a statute. And this is so that the people know what is going on in their government and what is happening. It applies basically to any business of the board. So that has a wide sweep. So, if it's about what you do as a board member, then it needs to be in an open meeting. And it also applies not just to your board meeting, but also to your committee meetings. All your committees have been set up by the board, and you're probably in some manner receiving monetary benefits from that, like your staff is all being paid by the board. So these kind of things mean that the board and all of its committees have to comply with the COMA. The meeting doesn't have to, pandemic, we've all found out that an open meeting doesn't have to necessarily be in person. It can be electronic. So it can be by telephone, it can be by Zoom, it can be by, Microsoft Teams, whatever means there is. There has to be a majority on there. So this is what happens. Let's say you've got 12 members. Only 6 people come, you don't have a majority, so you can't conduct any business. But once you have 7, you can conduct everything, you can hold the meeting, but then if it's only 7 out of 12, you're going to have a unanimous decision, to actually have any kind of final action. Um, The one thing, doesn't matter what you call the gathering, as long as you're all together. You've got a majority of you together to discuss the business of the board. So a lot of boards have what they call retreats or work sessions. That doesn't matter what you call it. If it meets the definition of a meeting, it's a meeting. That's why there was a discussion earlier that you don't want to get a COMA violation because you were at some private, a seminar or something and started discussing something. Hold it up, hold any discussion until you have a board meeting. The other way to get in trouble is through emails. Because emails are an electronic communication. If you have like an email that goes out to all of you and someone hits reply all and everyone starts jumping in and responding and discussing it, then you may have a COMA violation. So the main thing is do not hit reply all. A lot of times you're just going to be sent in things for informational purposes. Just this is a FYI, then treat it that way. Don't think that you have to respond to something, that just because someone sent something doesn't mean you need to respond. Just read it and go, nice to know, and close it out. The other thing about emails is that you, and someone can correct me if I'm wrong, but your particular board, I believe they have set you up with a email to use for board business. So it comes through, what is it? Gov.gov, I believe. So that is your state email account. That is the one that you need to use every time you're doing anything with the board. And you go, well, so don't get on your private account to respond to an email or to send something else or to use it to start discussing something. And that's important because they've made some changes to the COMA several years ago, because that's what people, not a board, but that is what was happening. People were using their private emails, government business that should have done that. So what they did to clarify this, it doesn't matter what server you're on. If it is discussing the board business, it's there. So if they need to go find that information that's being held on your private computer, your private email account, there are steps that can be taken to go get that to go get your private computer and get all that information off of your private computer. So if you don't want someone getting an order so they can snoop through all your everything that's on your private computer, don't use it for board business. Use the one that they have set up for board business. That's one reason. The other reason is that you, as a state board, you are under the Kansas Open Records Act. And that means anything that the board receives, creates, maintains, keeps, whatever, will be is a record of the board. And so consequently, in order to capture those emails, because they would be a record, you need to have them on the server for the board. And by using the board's email account, then that's how they are captured, so that way, then if they ever need to do a search for records, they can search that email account that ends in .gov, and they can find them. Do we have anything, that we need to keep for historical purposes or whatever? For not only just for CORA, but basically just because there's another statute that talks about state records. There's some other misconceptions about COMA. They think that a board is required to keep an agenda or to keep minutes, and that's not true. Most boards do have an agenda. They do keep minutes, but you're not required to. The exception being that when you have an executive session, that executive session does have to be recorded on minutes. So consequently, executive sessions, then you'd have to, if you don't create minutes, then you would have to create one for that meeting that shows the executive session. Executive sessions are controlled by statute. That's why they are so formalistic, as you've read one today. and you have another one coming up, there's information that must be in that motion. So that's why they are there. The most common complaint that is made to our office and to other the DA's office who enforce this are going to be primarily about executive sessions. They think someone was in the executive session that shouldn't have been there, or they went beyond, the discussion went beyond what was in the executive session motion, that it went too long, that type of thing. Or that when they came out of the executive session, they discussed the executive session. So why did they have an executive session? Other things is that you didn't give notice of the meeting. You are not required to publish, like in the Kansas Register and in newspaper, even on your website, that you're having a meeting. However, though, if people want to know that you're having a meeting, they can ask to be put on the notice that you give. So everyone who's been asked to be put on that list, they will get a notice of, hey, we're having a meeting on this date, time, and place, so that they can attend. But so if someone requested notice and you didn't give them notice, then that can be a COMA violation. So that's why all those notices that go out are so important. You can be prosecuted under the Open Meetings Act. It's a civil case. It's not a criminal action. It can be brought by the Attorney General's office. It can be brought by a county or district attorney or an private individual. There are some enforcement procedures. The burden doesn't lie with the complaint is made. The burden doesn't lie with the person who's making the complaint. It lies with the board to prove that what they did was correct. And for COMA, the ability to not have COMA apply is interpreted very narrowly. So you need to be very careful when you start to use COMA things that could result in a violation. What if people have filed it quick enough, they can ask to have a decision made be voided if it was not done correctly. They can ask for an injunction, which would be, it's too late, but they do an injunction to actually stop you from doing that. They can do a mandamus to force you to do something that you should be doing, or they can just ask for a declaratory judgment that, hey, what they did was wrong. The penalties for COMA violation, and this is where it becomes very important. The board doesn't, if there's a penalty, it can go for each violation up to $500. So if in one meeting you commit 2 violations, penalties could be $1,000 maximum, $500 for each one. That's not paid by the board. It's not paid by the state. It's paid by the board member. It comes out of your own pocket. So that's important to understand that. It can also result in ouster, recall from your office. You could also be told to pay court cost to the person seeking enforcement and to other types of court costs that are allowed under the statute. Our office has the authority to do a consent agreement that has findings of facts, and so that consequently it's very much like a court decision where it has findings of facts. It states what the violations were and then what the penalty is going to be. In this instance, so the penalty is only up to $250 for each violation. They can make you go do training at your own expense, and they can also make you acknowledge it, that you did violate it. So let's see. They can, again, do cease and desist and penalties. Don't want to, you can read those on your own. The next one is the Kansas Open Records Act. That is, again, as I stated, is that anything that is a public record is open to the public unless there is a specific provisions that allows it to be closed or to have the information redacted out of the record. And it's not talking about a piece of paper record. It's all records. So it includes electronic records. So that's your emails, videos that you may create. So it can be very broad. So when you get when their core request comes in, it's going to go to your information officer. That information officer's got 3 days to do something with it. And that can be that to acknowledge that we have your core request and we're working on it and we'll let you know what we find out. Or they could say, hey, that was a simple one. Here's the records you request. There's not, because it was so minimal, we're not going to charge you, or we can say we found your records, but these are the charges, because you are allowed to charge for open records request. It's the staff time to do a search for the records, to retrieve records, to copy the records, to redact the records, and then the postage costs to mail them out. So records requests can be simple or they can be very cumbersome and take up a lot of time, quite honestly. Depends on what the request is about. The board doesn't have to create a record. So if someone says, hey, I want a record of this, you don't create one if you don't have one. It's records that you have at the time that the request comes in. And you don't have to update them, like say, well, the next month, oh, that record request that you made last month, now we have a record. You don't have to do that. If they want to know if you create one later, they'll have to make another request. So you can request that if they put it in writing. You can't force them though to use your form that you have to make the request. Again, that's there's a reminder on there that email can be subject to core. So always remember that. When I talk, one of the things I also say, because your emails are open records, be very cognizant of what you say. What I try and remember when I write my email, sometimes, if you want to get snarky or the person really well and you want to make a funny comment, stop and think, how is this going to look on the front page of the Topeka Capital Journal, the Kansas City Star, the Wichita Eagle, or any other publication? Because that's likely where it could end up at. Anything you put down on writing, electronically or a piece of paper, if they make a core request and there's no basis to redact it or anything, all your snarky comments and all your funny little jokes are going to go out to the public. So when you do emails, try to be very professional. Then that way you won't be embarrassed by whatever comes out. The core request can be made by anyone. Some states, their Open Records Act require the person to be a resident of that state. Kansas does not have that. And like I said, it also applies, like I said, to paper and electronics. So that also includes any tapes or films, slides, pictures. There are certain exceptions, like for what you have, you probably get a lot, you may have medical records in your file because of your discipline cases. So consequently, those are closed out. Their employment records can be subject to COMA. There are some things though that can be excluded. It's pretty much limited to their name, their title, their salaries, or if you have an employment contract, but consequently, any type of like discipline or other issues that may be in that file or medical information, that's not something the public can get. And in this particular instance, if there's a violation and there's a fine that's assessed, it is paid by the board, not the board members. So because it's usually going to be board staff who does this, not the actual member. So the board, so it can result in the board having to come up with some money to pay. The Kansas Administrative Procedure Act, that is a procedural act. So it's not anything substantive. It's how, like when an application comes in or a complaint comes in, how you have to handle it. You have a CAPA procedure statute, and CAPA says that that it only applies to the extent that you have a statute in a different act that says it applies. So your CAPA statute's found in 651120 subsection B. And the way it reads now is it says that once that the board makes a probable cause determination, then the matter is then conducted under the Kansas Administrative Procedure. So you're not into that until that declaration has been made. That's leftover language from a long time ago when CAPA, when you were doing things under the Open Meetings Act, and then they switched to CAPA and they had some funky legislation in there. This is one of your funky ones that's left. Other boards have gone in and they have eliminated those kind of funky language because they were all different. Some of them said CAPA applied only for suspension and revocation. Those have all been eliminated, to my knowledge, by other licensing agencies, so that basically it's that all licensure issues under that particular licensing act would occur under CAPA. And it's basically CAPA, and the reason for that is cases under CAPA are not really have anything to do with the open meeting laws. They're more about an individual thing and not the broader business of the board. And so there is an AG opinion on that addresses that. That's AG opinion 2014-07. If you're having trouble sleeping some night, go find that order and start reading it, or opinion, and you'll probably be asleep in 10 minutes. It's very condensed and even attorneys had to read that a couple times to get through it, to understand it, because it tries to cover when open meeting applies and when CAPA applies. So under CAPA, nothing has to be open except for the hearing. So consequently, all the preliminary stages can be done in a closed proceeding unless the presiding officer wants to open up. And your CAPA proceedings are typically your applications and your discipline cases. So that's going to be the investigative committee that really deals a lot with CAPA and need to be very familiar with it. So CAPA, when you're under CAPA, there's no minutes that you have to approve. You're not going to be amending or regulations or anything like that, or doing any delegation or making decisions on contracts. Those are public policy issues or decisions, and those are done at an open meeting, not a CAPA proceeding, because a CAPA proceeding is about a specific identifiable person. It's like an individual case. It's like a lawsuit that's going on in district court. So it's, like I said, it's not this broader issue. It's just a very narrow function for that particular case. So just that's kind of one of the things you have to be aware of, is that, okay, is this a CAPA meeting or an open meeting? And again, always, if you're not sure, before you start doing something under CAPA when it should be under COMA, before you do that, always ask if you're not sure. And one of the attorneys can help you figure out, no, we've got to be we got to have an open meeting to do this. We can't do this in CAPA. So that's a quick procedure, and I think I got it pretty much at 1 hour. So are there any questions that anyone has about that? I'm glad you all understood it. But like, if you have any questions, just get them to Carol, and Carol and I can work with her on getting an answer to you. But again, and that would be an individual board member. Don't come together as a majority with one, because that's an open meeting question to get legal advice. So, but never feel afraid to get legal advice if you think you need it. We would prefer that you ask beforehand rather than try to fix something later. So, and I don't know, Will, do you have anything to add about how you do CAPA or anything like that?
No, Jen, I think you covered it.
Okay. I guess you can move on then if there's no questions.
Thanks, Jan.
And I will go ahead and leave the meeting. I don't think you need me for anything else, correct?
I think that's right. I think. Is that correct?
Okay, well, something pops up, just have Carol get a hold of me. Thanks. Bye-bye.
Thank you, Dan.
Okay, the next thing we have on the agenda is executive session number 2. And we have a motion somewhere to read for that, correct? But we need to decide how many minutes we're going to take to do that. And it is the performance review for Carol Moreland. We do that annually, usually in December. And so I don't know. Didn't anybody here help do that last year? Remember how long was it? 30 minutes or something that we put on there?
That sounds right, Patsy.
Yeah.
This is Juliana.
Yeah, I think we can do that. So Jill, do you have the motion so we can put 30 minutes in there?
Yes, I do.
Okay.
So, is there a board member who would like to make the following motion? Pursuant to KSA 75-4319 small b1, I move that the board reassess into executive session for 30 minutes and reconvene at 2:55 p.m. The remote meeting will be reconvened by Zoom and YouTube as stated in the notice of the meeting that was sent to individuals who requested the notice and as published on the board's website, www.ksbn.kansas.gov. The justification is to discuss personnel matters of non-elected personnel. The subject matter to be discussed in the executive session concerns an employee performance evaluation. To aid the board in its discussion, and Adrian Guerrero will join the executive session.
This
I
is
move.
Pat. So move.
Oh, I'll second. This is Becky.
Motion is second. Any discussion? All in favor say yes.
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 Opposed say no. Any abstentions? That motion carries. Okay, everyone knows. I see Adrian just text us with a phone number and an ID so we can make that happen with our phones. So you're supposed to mute and take your video off, correct?
Yes.